ആ മിസ് ഇത് വന്നിട്ടുണ്ട് കേട്ടോ ലൈവിലോ ആ മറ്റേ നമ്മുടെ ലിങ്ക് അയച്ചു കൊടുത്തു കഴിഞ്ഞാൽ കേറാം ആ ഹലോ മിസ്സേ
Recording in progress.
Without ethics, man has no future. This is to say, mankind without them cannot be itself. Ethics determines choices and actions and suggests difficult priorities, said by John Berger. Good morning to one and all. Myself, Bimida Sriyak, lecturer at Samaritan College of Nursing. I welcome all of you to this webinar on Ethics and Bioethics, an overview, hosted by Samaritan College of Nursing. First of all, we shall invoke the presence of Almighty God, epitome of true knowledge and wisdom. Let's have a silent prayer. Yes, it is my duty and privilege to welcome all of you to this webinar. First, I welcome Dr. Sister Shalini SD, our respected principal, moreover, the strength and backbone of our institution and the organizing chairperson of this webinar. Next, I am pleased to welcome Dr. Sister Sajina SD, Vice Principal of Samaritan College of Nursing, and inspiration to all our events. I also welcome Associate Professor Mrs. Sajna Koshi, Organizing Secretary of this webinar. With immense pleasure, I would like to welcome the keynote speakers of this webinar. The first session, Introduction to Ethics, Bioethics, and Ethical Principles and Process of Decision Making, will be led by Dr. Jeena Madhavan from Jain University, Kochi. The second session, Ethical Issues and Dilemmas in Healthcare, will be delivered by Dr. Rachel Jyoti Alex from Jain University, Kochi. I welcome both of you to this seminar. The participants decide the success of this webinar. With utmost pleasure, I welcome all of you to this webinar. Next is the inaugural session. I invite Professor Dr. Sister Shalini SD to make the inaugural address.
Everyone, good morning to one and all present in this online platform. In all your ways, acknowledge him, and he will make straight your paths. The book of Proverbs, chapter 3, verse 6. Yes, whatever we do, acknowledge God's presence. He will guide us to the right path. Today's webinar topic is Ethics and Bioethics, an overview. Ethics is a broad field that seeks to understand concepts of right and wrong. Non-ethical practices diminish the sanctity of the health services today. So, scenario. Ethical practice is a foundation for nurses who deal with ethical issues daily. Bioethics offers ethical guidance in a particular field of human conduct. Today, we have two resource persons, as mentioned, to deal with this topic. Dr. Jeena Madhavan and Dr. Rachel Jyoti Alex. Their biodata will be introduced by the moderator. Be attentive and make use of these webinar sessions. The presentation will be very useful for faculty and students. I wish all success for this webinar. I cordially welcome the resource persons, Organizing Secretary Ms. Sajna Koshi, all the delegates, faculty members, and nursing students to this webinar. With these few words, let me conclude, and I declare that this webinar is inaugurated. Have a great day. May God bless you all. Thank you.
Thank you, Sister Shalini, for the inaugural address. Before starting the session, a few instructions for the delegates. Delegates, please ensure that the microphones are muted to improve the quality of the session. If you have any questions during the session, just type them in the chat box or either YouTube. We have question and answer section at the end to answer your questions. The feedback form link will be provided in the chat box at the end of the discussion session, and the delegates will be awarded e-certificate after filling the feedback form. Delegates, please note that the feedback link will be active only for 15 minutes and ensure that you will fill the form with correct information. Next, I move to the heart of the event. It's my honor to mention about the first session speaker, Dr. Gina Madhavan. She completed her post-graduation in psychology from Kerala University in 1992, MPhil from MG University, Kottayam, and doctorate from Bharatiya University, Coimbatore in 2019. She has 17 years of teaching experience. Besides that, she has credits in various national and international publications. She has been a resource person for various state, national, and international conferences. Currently, she is working as the Associate Professor in Jain University, Kochi. With extreme honor and privilege, once again, I welcome you, ma'am. Over to you, ma'am. Thank you.
Thank you, ma'am. So, good morning, one and all present here in this platform. And with your permission, let me start the session. Is the screen visible? Excuse me, ma'am, is the screen visible?
Yes.
Yes, it is visible.
Okay, so shall we start?
Yes, ma'am, you can start.
So, good morning, one and all. So, as you all know that today's topic, it is an overview on ethics and bioethics. First, I will give you a small introduction on what ethics is. So, when we talk about the term ethics, certain terms are very important. The first one, that is the moral principles, and the second one is values. So these two terms are very important. First one is moral principles and the second one is values. Apart from these, certain other terms are also very important when we talk about the term, when we talk about the topic ethics, like integrity, then again, moral principles, honesty, right, fairness, responsibility, conscience, then choice, honor, value, etc., etc. But these two terms, which I mentioned earlier, that is moral principles and values, these are very important. So in our lives, we know that we often stick on to these two aspects, that is the moral principles as well as values. So why we are sticking on to these two aspects, that is moral principles and values, that we have to think about. Because the first thing is that it helps you to make a judgment whether your behavior or your action, that is good or bad. So good versus bad. These two terms you please keep in your mind. So as we all know that from very small classes onwards, the subjects, the moral science, that is included in the syllabus.
Excuse me, ma'am.
Yes.
Can you make it a slideshow?
Just 1 minute. Okay. Is it clear now?
Yes, ma'am. Now it's clear. You can proceed, ma'am.
Okay. Just a minute. Just 1 minute. It is not going to the next slide. Okay. So, as I mentioned, from small classes onwards, the subject that the moral science is included in the syllabus. Why? So the reason is to make even the small children, they are aware of their behavior. So whether their behavior or the action, it is good or bad. So that is why even in the smaller classes itself, the subject moral science is included. So in very simple terms, ethics deals with what is morally right or wrong. So that is a simple definition for ethics. What is morally right or wrong? So, or in other words, we can say that ethics deals with what is the right behavior in a particular situation. What is the right behavior? Or what is the bad or wrong behavior. So in our, we all know that in our daily life, we often stick on to the moral values. So when we act in a particular situation or when we take a decision, or in a decision making situation, we often think whether I am doing the right thing or I am going through a wrong path. We often make an analysis. So when you deal with the patient, or when you are working in a hospital setup, when you deal with the patient, the situation often comes in front of you. That means you have to think whether your behavior to that particular situation or to the particular patient, whether it is right or wrong. So we can say that the ethics as well as behavior are connected. So as I mentioned, the moral principles as well as values, these two aspects are associated with ethics. At the same time, ethics, it deals with or the ethics and behavior both are connected. So whether you are in the office or in the workplace, whether you are in the college, whether you are at home, some rules and regulations are there. And we often adhere to these rules and regulations. So these rules and regulations are connected to this. Hope it is clear. Or in very simple words, we can say that ethics means some moral principles or some values that guide our behavior. Or in other words, we can say that how we conduct an activity, whether it is you are doing an activity, whether it is in the right way or you are going in the wrong path. Okay, so a simple example when we talk about the ethics, especially in the field of nursing, is when you deal with a patient, it is your responsibility to maintain certain aspects like privacy, similarly maintaining confidentiality and trust. If you are maintaining these aspects, that means you are following the ethical guidelines. Okay. Otherwise, others may say that you are unethical. Okay. So ethics deals with what is morally right or wrong. Is it clear? So these are the moral principles as well as the values that are very important. These two terms are very important when you deal with ethics. At the same time, these the slide it is given. These terms are also very important when you deal with ethics. So next is why. So why ethics is very important, especially in the hospital setting, why this ethics is very important. So some points it is given in the slide. When you are in the hospital, you deal with the it is your responsibility to deal with or you have to, in everyday basis, you have to deal with the patients as well as with the family members. So when you have to pass so many information to the patient as well as to the relatives regarding the patient's condition. Okay, that you all know that. At the same time, you have to keep certain aspects very confidential. When you are dealing with the patient as well as with the family members, it is your responsibility to keep certain aspects very confidential. Right? Sometimes you have to make certain important decision regarding the treatment procedure. For example, uh, while dealing with the patients regarding the life-sustaining treatment for the patients who are terminally ill or very sick. For example, to make use of the palliative care. Suppose if a person is terminally ill, so whether to make use of the palliative care or how to do those aspects, you have to take some decisions. These type of situations when you deal with a patient who is terminally ill, the situation, it is very sensitive, and therefore it is your responsibility to respect the patient's wishes as well as the values. So in such a situation, when you are dealing with a patient who is terminally ill, you have to consider so many aspects. Sometimes the confidentiality have to be maintained, trust, that is very important. At the same time, you have to make so many decisions regarding the certain procedures, for example, the life-sustaining procedures. All those aspects you have to keep in your mind. And at the same time, it is the responsibility of the nurse to respect the the patient's wishes as well as the values. Similarly, ethical considerations that are also very critical in the pain management. These are some examples I am quoting regarding the pain management. When you are dealing with a patient who is terminally ill and who is suffering from severe pain, so the pain management, that also you have to deal. And especially in the case of a chronic or a terminally ill. So here also it is your responsibility to communicate openly and honestly with the patients and the families regarding the treatment. For example, discussing about the diagnosis, then again discussing about the treatment options. If any, what are the future complications regarding this a particular treatment, then regarding the prognosis. During all these aspects, when you deal with these type of aspects, here all ethics play an important role. Okay, so that is why I mentioned that ethics, it is very important in hospital setting. So ethics, it is what that guides us to tell the truth, keep our promises, or help someone in need. So you are dealing with different types of patients, and if you stick on to the ethics, it helps you to or it guides you to tell the truth. Sometimes you are able to keep the promises, and at the same time it helps you to help the patient who is in need. So we can say that the nursing ethics, it deals with individual ethical dilemmas that arise from the situations between the care provider and the patient. This point later we will discuss. Okay. Then Then next we have to deal with the topic. It is about the ethics as well as bioethics. So close to ethics, there is other term called the bioethics, that is especially in the field of nursing or in the healthcare sector, you have to deal with bioethics. So what is bioethics? So when we talk about the bioethics, always keep in your mind that it is a multidisciplinary area. That means a number of areas are involved in bioethics. Biology is involved, then medicine is involved, healthcare, all these aspects are involved in bioethics. That is why I mentioned that it is a multidisciplinary area. So bioethics, in very simple terms, it deals with a number of questions and the dilemmas which are related to the moral principles. So we know that I had already given an introduction regarding the ethics, and in the ethics, two terms I mentioned that is very important, that is moral principles as well as values. So the bioethics, it deals with a number of questions. A number of questions are there, and the when you work in this field, you are facing lot of dilemmas. So bioethics, it deals with a number of questions and the dilemmas which are related to this, the moral principles as values. So especially in the field of medical technology, then when you deal with the medical technology, then when you deal with the treatment procedures, then when you are in the research, different types of research practices, or when you deal with healthcare policies. So all these type, all these situations, we have to consider the bioethics. For example, when we talk about the bioethics, the key focus area that include, first, it is the medical ethics, then reproductive ethics comes under this bioethics. For example, you have to take certain decisions, or you have to think about whether your action or the decision, it is right or wrong when you are when it is associated with abortion, then surrogacy, then suppose if you're working with a patient who is undergoing IVF, so in whatever be the situation, we have to deal with these. So we have to deal with this bioethics. So medical ethics, under the bioethics, the medical ethics comes, then reproductive ethics, that is very important. Then another interesting topic, that is about the euthanasia. You are all, hope you all are familiar with the term euthanasia. So here also, in such a situation also, the ethical question arises. The decision about ending a person's life, suppose if a person is terminally ill, the ethical question, it often comes into the mind of the healthcare worker as well as the patient's family members about ending that person's life. Then another aspect or another area where the bioethics that is very important is regarding the organ transplantation. So the healthcare workers, they also face so many problems related to the organ allocation. Then what is the definition for organ donation purposes? So here also, here all these areas, that is in the medical ethics, the reproductive ethics, then euthanasia, organ transplantation, then healthcare policies. In all these sectors, the application of bioethics, that is very important. So as I mentioned, the bioethics, it is the study of ethical aspects of the, that means the moral principles, then values, integrity, honesty, all these aspects are involved in bioethics. At the same time, social aspects are there, then legal aspects are there, all these aspects are involved. So that is why in the initial area itself, I mentioned that the bioethics, it is a multidisciplinary area. So in simple terms, bioethics means ethics of medical and biological research. It is the ethics or the ethical aspects related to the medical and biological research. Okay. So now we will move to the next slide. So this is an example. So in the case of terminally ill patient, a doctor might be in a situation where they have to order a particularly large dose of morphine so that they can relieve the pain that the patient is going through. However, the doctor also knows that the dosage could also potentially kill the patient. According to the law, this is illegal mercy killing or euthanasia in technical terms. So long as the doctor has not shown that he or she has the intention to kill. However, that doesn't mean that everyone will consider it an ethically or morally sound decision. So this is actually a dilemma. So as I mentioned that here also in such a situation also, this is the case of an euthanasia or a mercy killing. And here also the ethical question often arises. So the decision, it has to be taken by the concerned authority about ending a person's life. Okay, so whether to do it or not. So it is something, so bioethics that is involved in this type. Okay, so here this is also a case study, but I am not going in detail to the case study. Just uh, I'll read it, and after that, it is few questions are there in the next slide. So Dr. P, an experienced and skilled surgeon, is about to finish night duty at a medium-sized community hospital. A young woman who is brought to the hospital by her mother, who leaves immediately after telling the intake nurse that she has to look after her other children. The patient is bleeding vaginally and is in a great deal of pain. Dr. P examines her and decides that she has had either a miscarriage or a self-induced abortion. He does acute dilatation and curettage and tells the nurse to ask the patient whether she can afford to stay in the hospital until it is safe for her to be discharged. Dr. Q comes in to replace Dr. P, who goes home without having spoken to the patient. So here the ethical question comes. I hope the case is clear to you. So often this whether the action by Dr. P as well as by Dr. Q, it is correct or not, whether it is right or not. So the above case study that invites the ethical reflection. So certain questions we can arise about the physician's behavior, the doctor's behavior, whether it is correct or not, whether it is right or wrong. Then the decision they made. Both doctors made certain decisions, whether it is right or wrong. Then the questions, we can ask some questions regarding the values and rights. And regarding the responsibility, everybody will have their own responsibilities in the hospital setup. Each nurse as well as the physician, or even if it is a paramedical staff, they have their responsibilities. It is their responsibility, adhere to the responsibilities. Okay, so all these questions you can ask. So the case study reveals that ethics deals with all aspects of human behavior and the decision making. So whether the moral principles and whether the values or the behavior or the action taken by the doctors or the people involved in the above case study, whether it is right or wrong, whether the behavior was right or wrong, whether they took a decision at the end, whether it is right or wrong. So the study of ethics, when you are working in the hospital setup, especially when you are in the nursing field, the study of ethics, that is very important because it helps or it prepares the nursing students to recognize the difficult situation. It helps you to identify what are the difficult situation, and it is also very important how you deal with that particular situation, whether you are dealing it in a rational or logical way, whether you are going or you are tackling the situation in a logical or in a systematic manner. So that is very important. So that is why the ethics as well as the bioethics, that is very important in the field of nursing. Then the process of ethical decision making. So in the above case study also, you came to you got the picture that the authorities or the people involved in that particular case, they have to take certain decision. So when you deal with a particular situation or when you deal with a patient, many times you have to take so many decisions. So as you know that the decision making, that is a very important aspect in our daily life. So in our daily life, the time when we get up in the morning, that time onwards, we are taking a lot of decision. Okay, sometimes the decision which you take are very correct. Sometimes the decision it may be an utter failure. So in the hospital setup, when you are dealing with the patients, ethical decision, that is a very important aspect, or it is a very major, we have to consider it as a major process. When you are in the process of ethical decision making, on you, it is better to keep in your mind that you have to follow a method. Okay, so for example, when the exam comes, definitely you have to spend a lot of time for studying. So you have to prepare a timetable. So in the morning, I have to get up at so and so time. I have to study this portion. I have to complete this portion within this limited time. So similarly, you are supposed to take a lot of decisions. So here also, when you deal with the patient or when you are in the hospital setup, the process of decision making, that is very important. So when you are in the process of not a simple decision making, ethical decision making, always keep in your mind that you have to follow a method. You, as I mentioned regarding the time when exam comes, you are preparing a timetable and you are following a particular pattern. That means you have a method to follow. Similarly, when you are in the hospital setup or when you deal with the patient, you have to, when you take a decision or when you are in the process of decision making, always keep in your mind that you have to follow a particular method. Then only you will be able to answer the key question in front of you. Here it is written, the key question in front of you. Otherwise, sometimes the decision may go wrong. So it has to go in an orderly manner. So your thinking pattern, it should go in an organized manner. That is very important. That when you take a decision, so the process called thinking, that is involved. So that thinking process, it has to go in an orderly manner. It is very important that you have to think in a rational way. Rational thinking, that is very important. Or in other words, we can say that you have to think in a logical way or logical manner. So rational thinking, logical thinking, that is, these two aspects are very important. Another important fact is that when you are in the process of ethical decision making, your thinking pattern, it should be in a sequential manner. That is also there in the slide, sequential manner. If it goes in a sequential manner, then definitely you will be able to find a correct answer to the situation in front of you. So when you are dealing with a particular problem or when you are in a dilemma, ethical dilemma, so you have to follow certain aspects, or when you take a decision, it should go in an orderly manner. That means first the process which I will mention, it will be there. It is there in the next slide. So that time I will mention it clearly. But rational thinking, that is very important. Then a logical thinking, that is very important. And it should go in a sequential manner. So these three aspects, rational thinking, then logical thinking, and the sequential, or it has to go in an orderly manner. These three aspects are very important. Then only you will be you will be able to find a correct answer to the situation in front of you. Hope it is clear. So we have to, the main situation, there is a situation in front of you and you have to find the answer to that particular situation. So that answer is considered as the chief goal. So determining right from wrong in situation where clear demarcations do not exist or are not apparent. So the situation is there in front of you and you are not, there is not a clear demarcation regarding what is right, what is wrong. but you are forced to take a decision. So just analyze the situation, then thinking, that is very important. Then rational thinking, logical thinking, and sequential. You have to go in a sequential manner. Then here I mentioned that sequential manner. So that means some process is involved. Okay, so now let us look what are the process. So the process of ethical decision making. So here, first you have to identify the problem. So the situation, the problem means the situation is there in front of you. You should be able to identify the problem. So what the patient is telling something, the patient is telling certain stories, or the difficulties which they are facing. So you have to, from that story, you have to identify what is the real problem. So identifying the problem, that is the first step. So next is identifying, it is written as identify the stakeholders. So here the second step means identify who are, identify the people, important people involved in that problem situation. Okay, so the patient or the family members or the concerned people are telling you a story, or sometimes they might be telling about the disease aspects, about the diagnosis or the treatment they receive. So from that you have to identify the problem, and after that the second step is the identify the people involved in the problem situation. So what all aspects and who all are dealing with that situation. So all the people involved in the situation, that you have to identify. Then after the first two steps are over, then you have to go to the next step, that is identify the alternative. Identify the alternatives means that is very important, because when we face a problem, so in our daily life also, when we face a problem, we have to take a decision. So many decisions are there. Decision one might be the, or not decision, alternative one might be the alternative two, alternative three, alternative four. So many alternatives are there, and from those alternatives you have to choose the best alternative. Okay, so the patient, the family members, then other concerned people, all are there in front of you. They are telling so many things regarding the situation, or regarding the diagnosis, or regarding the present condition. So you are identifying the problem, you know which all people are involved in that particular problem, and there's so many alternatives. You can build so many alternatives, and so many alternatives are now there in front of you. And from those alternatives, it is your responsibility to find the best alternative. Okay, then after once the best alternative is identified, then the next task is to identify the factor. So each alternative have its own pros and cons. If I am selecting the alternative one, so alternative one has its own merit. At the same time, it has its own demerits. So identify the factors means from the alternatives, you have to find what are the merits and demerits of the specific alternatives. What are the pros and cons of alternative one, alternative two, alternative three, like that. Okay, then so after finding the pros and cons, then only you will be able to find or select the best alternative. Okay, so different alternatives are there, and you have to analyze what are the merits and demerits, or what are the pros and cons of each alternative. And after that, you select the best alternative. Then next step is the propose and test. So propose and test means after that, you can tell the patient as well as the family members that if you select this alternative, or if you go in this path, it will be more suitable for you. Okay, so this is the fourth fifth step, and finally at the end you are taking a decision. So this is the process involved in decision making. So when you make a decision, or when you are in the when a situation comes where you have to take an ethical decision, so you have to follow these steps. That is, first you have to identify the problem, then second, you have to identify all the people involved in that problem situation, then you have to identify the alternatives. So many alternatives will be there, and from that alternatives you have to develop what, or you have to find out what are the merits and demerits, or what are the pros and cons of each alternative. And after that you have to propose, this is the best alternative. You are giving you're just giving a suggestion to the patient or the family members, that if you go with this alternative, it will be best for you. Finally you are in the decision making process. So these are the different steps involved in the process of ethical decision making. Okay. So again, this is also a case study. So Samantha is a 28-year-old college student who is 18 weeks pregnant. She has a history of cardiac disease that has worsened because of the pregnancy. So Samantha's doctor is concerned that continuing the pregnancy can cause her heart condition to worse and could result in a life-threatening emergency. He has recommended termination of pregnancy within the next 2 weeks. Samantha is reluctant, stating that although she does not currently go to church, she was raised to believe abortion is wrong and believes God will heal her. She wants to know what the nurse would do in her position. Nurse Jennifer does not believe in abortion under any circumstance. So this is a case. So here, whether the how the nurse Jennifer is supposed to in such a situation. Okay, so here also the nurse Jennifer has to take certain decision. So Jennifer has to pass through the 6 stages which I mentioned in the decision making. So first, Jennifer has to identify what the real situation is. Then she has to identify who all are involved in the situation. Then she has to identify the different alternatives, or different alternatives in front of Samantha. Then she has to identify if Samantha takes a particular decision, what will be the after effect. Whether it will be good for her, or it is going to affect her very badly. So all these alternatives she has to analyze, and finally she can tell or propose the particular suggestion in front of her. And in the final stage, she is taking a decision for the Jennifer helps the Samantha to take a decision. Okay, so this is a case study, and you after the class, students, you please sit together and discuss each of these cases. Okay. Then this is also another case study. So this will make it more clear to you. So this is a very good example for bioethics also. So I'm not going in detail on these case studies. So I'm skipping this portion. So I will, after the class, I will pass the PPT to the concerned teacher, so that after the class, you can go to the each of these case studies mentioned here. So this is another case study. So in this case study, I have mentioned about ethical dilemma, but this actually Dr. Rachel Madam, she is supposed to take the ethical dilemma. This is a case of ethical dilemma, because often a situation comes when you work in the nursing field. A situation often comes, or a state of confusion often comes in front of you, where a number of options are there in front of you, and you find it difficult to take a decision. So in such situation, we call that situation as or you are in an ethical dilemma. So anyway, I'm not going in detail. Then now next it is about the ethical committee. Just a minute. So ethical committee, okay. So in our daily life, when we feel that we are in a crisis, okay, or when there is a crisis, now I'm talking about our daily life. When we are in a crisis situation, it is quite natural that we often seek help from our friends. Sometimes we seek help from our teachers or from our parents. Similarly, in the hospital situation, when you face an ethical dilemma, a group of people are there to help you. The group of members we call as ethical committee. So once again, I'll make it clear. Suppose when you're working in a hospital or in a healthcare sector, and you are in a crisis situation, you are dealing with a patient who is having some sort of illness, I mean, terminally ill or chronic illness, and a situation comes when you find it very difficult to take a situation, or you can say that you are facing an ethical dilemma. So a group of members will be there in the hospital setup, who is there to help you. So we can say that and we can call those group of members as ethical committee or ethics committee. So the main role of ethical committee is to offer or is to give assistance to the person who has difficulty in making a decision. Or in other words, when you are in an ethical dilemma, there are a group of people whom we call as ethical committee, and they are giving you assistance for what? To make a decision, because you are in an ethical dilemma. Okay. So the ethical committee, they often review the specific situation. So case reviews will be so that means the ethical committee, they review the specific situation, or they study the situation. They sometimes, in most of the cases, they analyze the situation, and sometimes they may talk to the patient as well as the informants. After this process, they will provide an opinion about the particular situation. Okay, so when you face a crisis situation in the hospital setup, and you are in an ethical, you are in a dilemma, because you find it very difficult to take a decision. So the decision making process, that is blocked. Okay, so you can approach a person or a group, I mean a group of people, and they will provide you an opinion about the situation. Okay, so the ethical committee, it is the responsibility of the ethical committee is to study the situation. They analyze the situation. They talk to the patient as well as the concerned members of the patient, and finally they will provide an opinion regarding the situation. But here, the thing is that the providing an opinion, it is not an easy thing. They have to consider so many aspects. Just they are not simply giving an opinion or suggestion, but they have to consider so many aspects. And finally, the opinion regarding the particular situation have to be from the ethical point of view. They are not simply giving a suggestion or opinion to you or to the patient, but they have to consider so many aspects, and finally they are giving the opinion or suggestion from the ethical point of view. That term is very important. They are giving the suggestion only, they are giving their opinion, or they are providing the opinion from the ethical point of view. So reviewing the situation, that is the main role of the ethical committee. So case reviews, they are doing the case reviews. That means reviewing the situation, that is very important. That is the one of the main responsibility of the ethical committee. Apart from the main functions of the ethical committee, some other aspects are also very important. As we know that hospital will have its own vision and mission. So the formulation of each and every hospital's policy formulation, that is based on its vision and mission. So in the formulation of the policy, the ethical committee is also involved. Therefore, the policy will be made in such a way that it helps to resolve the ethical dilemmas. So that means every hospital will have its own vision and mission, and this vision, the policy for similarly, apart from the vision and mission, the hospital will have its own policies. So the policy formulation, it is based on the vision and mission, and the ethical committee, here also ethical committee plays a major role. That is in the formulation of the policy making, the ethical committee, that they are involved, and the policy, so that the policy will be made in such a way that it helps to resolve the ethical dilemmas. Then here, proper education related to the healthcare aspects will be given to the staff. Again, the community education, in all these aspects, the ethical committee is involved. And as I mentioned, the case may be reviewed properly. Then healthcare systems provided, as we know that the healthcare systems, they are providing a lot of interventions. So ethical committee often supervise whether these interventions are in accordance with the protect of patients' right. Okay, so especially they are involved in, especially when you are involved in the community intervention program, it is the responsibility of the ethical committee to supervise whether these interventions are in accordance with the protect of the patient's right. So in these are some of the functions of ethical committee. So here it is given. The functions include, as I mentioned, the case consultation. They are analyzing the case. They are they go into they are taking the case study, in-depth case study. They study the situation, they analyze the situation. So the case consultation, that is very important. They are supporting the staff. They are giving proper education to the staff members. Then community engagement, as I mentioned, that in the, suppose if you're doing an intervention program, so they often supervise whether these interventions protect the patient's right. Then in the for policy formulation, here also ethical committee plays a very important role. So the ethical committee, it gives importance, or in other words, if they are doing all these aspects of, or they are involved in all these aspects, we can come to a conclusion that the ethical committee, it gives importance to the patient's patient as well as family satisfaction. They are more concerned about the patient as well as the family's satisfaction. And at the same time, they provide staff with ethical education. So what is ethics? Here, now I am giving you an overview on ethics. So similarly, the ethical committee in the hospital, they provide the staff with ethical education, like what is ethics, what is its importance in the healthcare sector. All these aspects, it is the responsibility of the HEC, or the hospital ethical committee, to provide the staff. Then sometimes the legal liabilities may come. So how to handle it? So for example, accident case, or if a suicide case comes in front of you. So definitely some legal liabilities will be there. So how to handle that situation? So if you're in a ethical dilemma, ethical hospital ethical committee will be there. They analyze the situation, they study the situation, and they finally help you to take a decision, or they provide an opinion how to handle the situation. And in some cases, the ethical committee also provide you information how to discontinue undesirable or inefficient treatment. All those aspects, the ethical committee provide a lot of information. Then now here I mentioned hospital ethical committee. So committee means a group of, as I mentioned earlier, a group of members are there. So now let us look what are who all comes in this committee, or who all are the group members. So the doctors are the doctors or physicians will be there, definitely. The nursing staff will be the social workers will be the, then administrative members, some selected administrative members will be the paramedical staff will be the psychologists will be the all these members. So all these group of members constitute the ethical committee. So, in summary, one point I would like to add is that in the process of decision making, if you are facing a dilemma, you can approach the ethical committee. So, important aspect is the final decisions are made by the family and healthcare team. So, they are giving you a helping hand, but the final decision, you are in a crisis situation, you don't know how to take the decision, so you approach the ethical committee. So the ethical committee is but the ethical committee is providing you certain opinions or help you in decision making, but the final decision are made by the patient, family members, and the healthcare team. Is it clear? Then, when we talk about the ethical committee, certain points you have to keep in your mind. So, committee means a group of members are there. They have certain functions. They are experts in that particular field. They know how to handle the case. They know how to handle the legal aspects. They are providing you a helping. Okay, is it clear? Then, so here also, what are the purpose of ethical committee? Who all are involved in the ethical committee? So all this, the important points are there in this slide. Then ethics committee members discuss the information which has been gathered. Ethics committee makes suggestions about the best course of action. Then often there are a number of options available in the course of a patient's care, because as you know that the decision making, that is very important, and in the decision making so many alternatives are there in front of you. From the different alternatives you have to you have to select the best, or you have to find the best alternative. So that is why it is written here that often there are a number of options available in the course of patient's care, and the final decision, it is not made by the ethical committee. The final decisions are made by the patient, by the family, and the healthcare team. Okay. So here also I made a example in decision making. Later you can go through these examples. So here this is a very good example in the experiments. So hope you all have heard about the Nazi camp, Nazi concentration camp. So here also it is a famous experiment, famous thing which you all know. hope you all have studied even in the school days. The doctors conducted so many experiments where they kept the patients in the compression chambers. Also, they created gunshot wounds. So the question is whether these type of experiments, even if it is with animal, is it ethical? Okay, so here comes the role of ethics. Then next, it is about the code of ethics. So what is the meaning of code? Code means something in a written form. Code means it is something in a written form. So here HEC, I have written in the previous slide HEC, H Hospital Ethical Committee. It is a code. So code is something, it is something in a written form. So here also the topic, it is about the code of ethics. So code of ethics, that is also a document in a written form. In very simple words, it is a document in a written form. It is a document, so I mentioned that it is in a written form. So it consists of a set of principles. So many principles are there. The professionals in the healthcare setup are supposed to act according to this set of principles. So it is a written document, a set of principles are there, and the professionals who are in the healthcare sector, they are supposed to act according to this set of principles. So when the professionals, and the professionals means it can be the doctor or the physician, the nurses come under this, then the paramedical staff. So all these, so in the hospital setup, as you all know, a team of members will be there. So when this, I'm calling all these team of members as professionals, and when the professionals act according to this code of ethics, what happens? This means that we can come to a conclusion that they are working honestly and also working in a beneficial manner to the patients. Okay, so in group, some written rules or written principles are there, and so many members are, or the team members are there in the hospital setup, and when these members, team members, act according to this code of ethics, what happens? We can come to a conclusion that they are working honestly and also working in a beneficial manner to the patient. So the code of ethics, it was defined, or it was designed by the professional body. So the code of ethics, as I mentioned, that it is a written document. So who made this written document? It was designed by a professional body. That means professionals are involved. Professionals, I'm not mentioning who all are the professionals. So many professionals are involved. Then management members, crucial members from the management will be the then association members. All these members are involved. They sit together, they discuss, and finally they design a set of principles where you are supposed to adhere to those set of principles. So this we call as code of ethics. So the code of ethics, it is usually in a written form. It is a document. That document consists of some core values as well as ethics, where you are supposed to follow this values and ethics. And it is designed by a professional body. Then now moving to the next topic. So this, all those things I mentioned. So then next is this ICN. That is, hope it is familiar to you all. ICN means it is the International Code of Ethics for Nurses. International Code of Ethics for Nurses. Actually, this ICN, it is a regulatory body. So when you work in this particular profession, even on daily basis, you know that you often pass through a lot of crisis situation. At the same time, it is your responsibility to fulfill the professional obligations. So you're passing through a crisis situation. So by that, when you pass through a crisis situation, you have to take a lot of ethical decision. So that ethical decision making process that is involved, and at the same time, it is your responsibility to fulfill the professional obligation. So you have a lots of professional obligations, and you have to fulfill that professional obligation. So here comes the code of ethics. Okay, and this code of ethics help you to support you to reduce your stress and strain. So you're passing through a crisis situation, and you are experiencing the stress and strain. Sometimes you may find it very difficult to take a decision. So here the code of ethics, if the code of ethics are the, if you are clear of the code of ethics, then it helps you to support. So that there will be a reduction in the stress and strain which you experience. So the code of ethics, it was first adopted in the year 1953, and it has undergone many revision. So as I mentioned that it was it's a regulatory body, or in other words, we can say that it is an autonomous body. It is under Government of India, Ministry of Health and Welfare. So now, so the main aim, it is to provide uniformity in nursing education, uniformity in nursing education, then the promoting the research activities, then promoting the training programs, prescribing the professional conduct, and again prescribing the code of conduct. So all these are the main aims. So uniformity in nursing education, that is very important. Then research activities for the if this area has to develop, research has to be done. So the promoting the research activities, then conducting training programs in the even in the community level, that has to be done. Educational programs, awareness programs, all those things have to be done with the help of this ICN. Then prescribing the professional conduct and a code of conduct. So these are considered as the main aim of ICN. Then now coming to the 4 principal elements in ICN code of ethics. So here it is divided into 4. 4 elements are there. First is the nurses and people. Second is the nurses and practice. Then third one is nurses and the profession, and the last one is the nurses and co-workers. So first it is the first element is the nurses and people. So when we deal with this ICN code of ethics, nurses and people. So I will give the essence of this nurses and people. This particular element, that is the nurses and people, it points that as a nurse, certain aspects like providing appropriate nursing care by giving importance to the human rights and values. That is very important. That is, it is, as you know, that it is the responsibility of a nurse. The basic responsibility is to provide nursing care. When you're giving this nursing care to the patient, you have to give importance to the human rights and values. Then again, not only the human rights and values, but also you have to maintain the confidentiality. And at the same time, you have to give importance to the professional values like integrity, then again, trustworthiness, compassion, etc., etc. So these are the main aspects which you have to keep in your mind. Okay, so this point, this particular element states that the uniformity in nursing, when you go through, when you deal with a patient, certain aspects like providing the nursing care, then give importance to the nursing aspects, maintaining confidentiality, then confidentiality and integrity, trustworthiness, compassion, etc. are very important. Then the second point is nurses and practice. Just a minute. Okay, sorry for the interruption. The second point is regarding the nurses practice, nurses and practice. So the nurses and practice means, suppose your course, nursing course is over. That doesn't mean that your learning is over. So learning in any learning may or learning in the field of nursing, it is a continuous process. So once the course is over, you may feel that my learning, that procedure is over, but learning, whatever learning in any field, or learning in the field of nursing, it is a continuous process. In many situations, you have to be competent. Whatever be the situation, when you are dealing with a particular patient, you have to be competent enough. Then only you may be able to handle the situation confidently. Okay, so if you want to handle a particular or a crisis situation in a confident manner, you have to be very competent enough. So competent in the sense, you have to be aware of the latest technologies in the field, that what all advancements are happening in this area. You should have a thorough knowledge regarding all these aspects. Then only you can say that you are competent enough to handle the situation. So competence, when we talk about the competence, the technological aspects, what all advancements are happening in this area, what are the researches happening in this area, you should have a thorough knowledge regarding it. You should update your knowledge. So in short, the nurse should be a person who promotes ethical behavior and open dialogue. So when we talk about the ethical practice, so here the importance, two terms are very important. The learning process, learning, always keep in your mind that learning means it is an ongoing or a continuous process, and at the same time, you have to be very competent to deal with the situation. So how can we say that we are competent enough to deal with a particular situation? So here the knowledge, that is very important, that what are the latest technologies in the field, what all advancements are happening in this area, you should be aware of it. Then only we can say that you are competent enough, or you are able to handle the crisis situation in a confident manner. Okay, so this is the essence of this second element or the second point. Then moving to the third element, that is nurses and the profession. The research that is very important, as I mentioned, that it is very important in this way. So for the nurse, research based on professional knowledge, that is very, very important. At the same time, she should be able to develop and sustain professional values. So sustain the professional, what are the professional values? All these comes under ethics. She should be aware of it. And also she should give importance to the natural environment, as it is very important that she is aware of the impact of natural environment and health. So there is a connection between the natural environment as well as health. So for example, if there is not in our country, we know that especially in Kerala, there is no proper disposal, proper design for the waste disposal. Okay, so what happens? So the natural environment, it is filled up with waste, so that the mosquito, it will increase and it can lead to dengue fever. Okay, so as when you work in the nursing field, you should know what is the, you should give importance to the natural environment, and also you should know how it is going to affect the what is the impact of natural environment on our health. Okay, then last point is the nurses and the co-workers. So as you all know that when you work in in an organization, it is your responsibility, or if you have to maintain a cordial relationship with the co-workers, that is very important. Then only you will be able to enjoy the peace, then only you will be able to enjoy the work situation, so that you are able to work very productively. So nurses and co-workers means when a situation comes, it is not possible for you to handle the situation alone. So many other team members will be there. So it is you have to maintain a cordial relationship with co-workers. That is very important. And at the same time, so you should also give importance to the individuals around you, the family members, the patient as well as the family members, your family members, and the people involved in that community. Okay, so when I go through this, when I was preparing this preparing for these four elements, that is the first one is the nurses, people and the nurses and people. Then the second is the nurses and practice, then nurses and profession, and final is the nurses and co-workers. Hope you all know about Sister Lini, who died 2 years back because of Nipah. So how she managed each and every patient, how she handled the situation, that we have to remember. Okay, so these are the 4 elements of ICA. Then when we talk about the principles of ethics, so we are dealing with the ethics. 4 principles of ethics are the, that is autonomy, beneficence, justice, and non-maleficence. So these are considered as the 4 pillars of medical ethics. First, as you know that autonomy, you know the term autonomy means freedom. So here in the field of nursing, when you work as a nurse, autonomy, that is very important. That means you have to give respect for the patient's right to self-determination. Then beneficence, so in the ethics, as I mentioned, moral principles and as well as the values, you have to stick on to the moral principles as well as the values. So here the term beneficence means the duty to do good. So even in our life, whether it is in the nursing field or in whatever be the field, it is our responsibility as human beings, it is our responsibility or our duty to do good. Then non-maleficence, that means the duty to not do bad. So sometimes in certain situations comes when we know that we are going in the wrong path. So that time you have to think it is your responsibility not to do that. Then justice. Justice means to treat all people equally and equity and equality. That is very important. So you have to treat all the people equally and equitably. So these are the 4 ethics. So this is also very important. Autonomy, beneficence, non-maleficence, and justice. These are the 4 principles of ethics. So when you work in the field of nursing, you have to always keep in your mind autonomy. You have to respect the patient's freedom, then beneficence. It is your responsibility to do good. Then non-maleficence, it's your responsibility not to do bad. And you have to treat all the people around you equally and equitably. Even if it is in the hospital situation, the clinical setup, or sometimes you go out for community in the community setup, then also you have to keep these 4 points in your mind. Then next is regarding the patient's bill of rights. So so a bill of rights. Bill of rights, it is again, bill means it is a declaration. For bill means it is a declaration, and in general, and bill of rights means it is a declaration of rights or a list of rights. So there are actually in this bills of rights, there are 17 points. So this bill of right, we have to practice this bill of rights because it promotes research in nursing, and it regulates policies for nursing training programs, etc., etc. So why the patient's bill is important? So there are different versions of the bill, but in general, it safeguards a patient's right according to the accurate and complete information. The patient, it is the right of the patient to get the fair treatment. Then again, self-determination, that is very important. The patient should expect to be treated with sensitivity and dignity, with respect for the cultural values. So considering all these aspects, the professional body made a bill. So it is to protect the patients, mainly to protect the patient. This patient's bill of right, it was mainly to protect the patient's right. So we will discuss one by one. So first is the right to information. So first, right to information means it is the responsibility of a nurse or a qualified assistant to give adequate information, sometimes to the patient or to the family members regarding the illness, sometimes regarding the diagnosis, tests, medicines, etc., etc. Okay, so when the patient comes to the hospital and he is receiving the treatment, but sometimes he may be in a confused situation that the patient doesn't know what is happening here. So it is a responsibility, it is the patient's right. Actually, it is the patient's right to know about what is happening or what is going on, what type of treatment I am receiving. It is the patient's right. So here it is the responsibility of the nurse or a qualified assistant to give adequate information about the patient, or sometimes to the patient or to the family members regarding what is the illness. About the illness, about the diagnosis, what all tests he has to undergo, what all medicines he is taking. Sometimes the patient asks, it is the patient's right to ask about the regarding the treatment plan. Regarding what all complications can arise. If the patient asks, if I go for this a particular treatment, for example, chemotherapy, what all complications can arise? In such cases, the patient, because in certain cases, suppose if the patient is have some sort of cognitive or a disorientation, so the patient may not be in a condition to understand what the concerned person is telling. So it is your responsibility to inform the bystanders or the proxy regarding the situation. So when these information are passed from the patient or to the family members, it should be in a simple language. That you have to know. Don't use any medical terms or don't use any jargons. It should be in a simple language. Also, so that the patient as well as the informants have the informants are able to understand what is happening in this hospital setup, what treatment the patient is receiving. So in short, it is the patient's right to know about what is the status of the patient, what is the what type of treatment he is receiving, what are the test results. Okay, then again, the cost of treatment, that also have to be explained very clearly. Then it is better, and if you are giving the cost of treatment, it is better to give in writing. So this is called the right to information. So I'll explain it in simple terms. That is, when the patient gets admitted in the hospital, the patient has the right to know about what type of treatment is going on, what all facilities are there in the hospital, what are the test results, what are the cost of treatments. All these doubts are there in their mind. So they have the right to ask, and it is your responsibility to give adequate information, sometimes to the patient or to the family members. So also, when you're passing the information, you are not taking the decision alone. You have to discuss with the concerned physician or the doctor. Then after that, you can pass the information to the patient or to the family members. Then second point is a right to records and reports. So the investigation, when the patient gets admitted in the hospital, the investigation reports will be there, then case papers will be there, sometimes discharge summary will be there, death summary will be there. So many papers will be there. You have to handle so many papers. So the originals, if needed, have to be given to the patient or to the relatives. Again, I am not mentioning it that with the permission of the doctor. Okay, so the death summary, if it is a death summary, if it is a discharge summary, if it is a case paper, or if it is an investigation report, so originals, if needed or if asked by the patient, it has to be handed over to the patient or to the relatives only with the permission of the doctor. Okay, so this has to be done in 24 hours. That is 24 hours of admission or 72 hours of discharge. There is a time limit. So you have to know about the time limit, and within that prescribed time, you have to hand over the records. So that is the second point. The third point is a right to emergency medical care. So right to emergency medical care means in emergency situation, you can avail medical care in any government or private hospital. So most of the people doesn't know, I don't know how many of you know, and whether it is applicable in our country. I'm not that much sure about it, but the ICN says that in the emergency situation, the patient can avail the medical care in any government or a private hospital. So here my doubt is the legal liabilities or the medical insurance, all those aspects we have to consider at the time of admission. So how much this is applicable, I'm not sure about it, but right to emergency medical care. That means in the emergency situation, the patient can avail the medical care in any government or the private hospital, because the patient has the right to get the medical care in emergency situation. So it is when the patient is in an emergency situation, it is the right of the patient to get the medical services. So whether it is private or government hospital, it doesn't matter. Then next is this is the fourth point, right to informed consent. Right to informed consent means, suppose the doctor decides that the patient has to undergo a surgery or an invasive investigation, or for example, a chemotherapy. So suppose the patient has to undergo chemotherapy. Then it is the responsibility of the concerned doctor as well as the assistant to inform the patient regarding the procedures, its purposes, then what are the risk factors associated with this, etc., etc. and also to get the consent from the patient or from the caretaker. So before going to a procedure, it is to get the consent from the patient. That is very important. At the same time, the patient, it is the responsibility of the either the doctor or the medical team to inform the patient that inform the patient or the family members that the patient is undergoing this type of procedure, and what the procedure, you have to explain what the procedure is and what are the complications associated with this, what are the pros, all the merits as well as demerits or pros and cons, all those things you have to explain in detail. Okay, so next is a right to confidentiality, human dignity, and privacy. So, whatever be the illness or the treatment plan, it is the responsibility of the healthcare team to hold the confidentiality. Okay, so this point I already mentioned in the when I talk about the ethics. So the doctor or nurse is supposed to talk the details only to the patient or with the caretaker. Sharing the information or the patient details to others is not at all a good practice. So we have when you work in this, when you deal with the patient in a crisis situation, or suppose if a patient comes with HIV, so the information has to be keep very confidential. So it is your responsibility to hold the confidentiality. So the healthcare worker who is supposed to talk the details only with the patient or with the concerned family members. So the sharing of information or the patient details to others, it is not at all a good practice. And also, suppose another example is that, another point is that, suppose a female patient comes to see a male physician. So here it is mentioned, male physician. The female patient has the right to demand the presence of another woman in that room. So it is the patient's right. So the right to confidentiality, right to human dignity and privacy, all these confidentiality, human dignity, privacy, all these are the patient's right. So it is it is your responsibility to hold these things. The next point, right to non-discrimination. So as you know that discrimination, it is not a good thing on the basis, whether it is on the basis of gender, age, religion, caste, whatever it be. So it is not a good practice. It is usually it is a natural phenomenon that humans have a tendency to discriminate certain class of people. So when it comes to the healthcare sector, the tendency often comes to discriminate the patient, especially the patient who is having HIV, leprosy, TB, etc., etc. So similarly, apart from this type of disease, when these diseases come, a patient with this type of disease comes in front of you, we often have all of it's a human tendency that we have a tendency to discriminate. But apart from these aspects, certain factors like gender, age, religion, etc., comes under the patient's right to non-discrimination. So based on these characteristics, no person can be subjected to discriminatory treatment. Okay, then coming to the seventh point, that is right to safety and quality care according to standard. That means the patient has the right to be safe and secure at hospital. Then it is the responsibility of the hospital to provide a safe drinking water, then cleanliness of the hospital environment, then proper sanitation. All these are the patient's right. Okay, then coming to the eighth point, that is right to choose alternative treatment options. That means options if available. When a patient comes to the hospital for treatment, remember a number of treatment options are there in front of it. So it is a responsibility of the staff, or main responsibility, it lies in the head of a doctor, and also the nurse also play a major role to clarify these doubts. Okay, so many options are there in front of them. So it is the responsibility of the doctor or the medical team to clarify this doubt. That is, which option is good? What are the consequences if you choose a particular option? Okay, then next is the right to a second opinion. When we talk about the right to a second opinion, for example, if the patient is diagnosed as is having tumor in the brain, and Dr. X suggested for a major surgery, then it is quite natural that the patient as well as the family members go for a second opinion. It is quite natural, second opinion, or they will go for an expert opinion. In such a situation, it is the patient's right to seek expert opinion. The hospital doesn't have the right to dispose the patient. So if they are in a critical situation, so if they are subjected to, if the particular hospital says that they have to undergo a major surgery, definitely the patient as well as the family members seek an expert opinion. It is the patient's right. So you should understand that it is the patient's right. You can't compel the patient that you have to done this surgery here itself, or you are not supposed to consult any other experts in the field. So it is you are not supposed to do that. It is the right of the patient to go for a second opinion. Then next point, right to transparency in rates and care according to prescribed rates. According to prescribed rate, wherever level. So when a patient is receiving treatment from hospital, the rate or the bill regarding each procedure, that is very important, because money, that is very important. Sometimes some patients may be in a financial crisis. So it is the right of the patient to get all these aspects in detail. So the bill and the rate of medicines, the rate of devices. So the services regarding these aspects have to come from the authority. Okay, so when you deal with a patient, you should be able to give a detailed or a clear picture regarding the bill, then the rate of medicines. Suppose if they are using certain devices, stent or something like that, no, the rate of the devices, the quality of the devices, all those things have to be very transparent. Okay, so that is regarding the right to transparency in rates and care according to the prescribed rates wherever relevant. Then next is right to choose the source for obtaining the medicines or test. That the patient has the right to purchase the medicines or devices from any registered pharmacy. If there is any registered pharmacy, they can purchase it from the registered pharmacy. Then right to proper referral and transfer. That means if the patient is transferred from one hospital to another, then it is the right of the patient to know why, for what, the facility, for what he is transferred, and what are the facilities available in that hospital. All those things, it is the patient's right to know about all these things. Then the next point is that right to protection for patients involved in clinical trials. So if the patient is involved in clinical trials, it is his right. It is the protection, or protection is the right. It is the right to protection for patients. They have to get adequate protection from the concerned authority. if they are involved in any sort of clinical trials. Then next is right to protection of participants involved in biomedical health research. As we all know that a number of researchers are conducting in this area, in the field of nursing. So before starting the research work, getting the consent, that is very important. Then keeping the participants' privacy as well as confidentiality, that is very important. Again, the important point is that no harm to the patient. That is very important. So the protection right, it is the patient's right. That means the protection of the participants involved in biomedical health research. Then next point number 15, the right to be discharged, right to receive the body of a deceased person from the hospital. So as you know that at what time, once the treatment is over or once the patient feels well, he has to get discharged. And suppose if the patient, the death occurs, they have the right, the family members have the right to receive the body of the deceased person from the hospital after completing all the formalities. So then next is the right to patient education. As you all know that a person, suppose if a person with a dengue fever comes in the hospital, so the patient has the right to know about the disease, and at the same time, what are the major facts about the condition. So after discharging from the hospital, what are the healthy practices, healthy living practices they have to follow. Then the rights and responsibilities about the health insurance schemes. This most of the patients will ask when they admit in the hospital. The first majority of the patients or the family members, they will ask about the health insurance schemes. Then relevant entitlements, that is especially for the charitable hospitals, and how to seek redressal of grievances. All those things the patient have the right to ask or to know about these aspects. Then the last point, it is about the right to be heard and seek redressal. Suppose if the patient, if some patients have some grievances regarding the treatment or in the approach of the healthcare workers, they can address it through the feedback, or most of the organization, they have a redressal cells, and through the redressal cell, they can inform the concerned authority regarding their grievances. So it is the hospitals have to heard and seek redressal. Hospital have to hear what the patient's grievance is. So that is called the right to be heard and seek redressal. So with this, I come to the end of this topic. So hope you all got an idea regarding what ethics is, what is ethics, what is bioethics, what are the ethical committee. All these aspects are very important when you work in the field of nursing. So when you work in this field, always think about the two aspects, that is that you have to keep the moral principles, and at the same time you have to keep the values. So thank you for the patient listening.
Thank you, ma'am, for your excellent presentation. So delegates, if you have any queries, you can post your questions in the chat box or YouTube. We will answer your questions in the discussion session. Now, next I welcome the eminent speaker, Dr. Rachel Jyoti Alex. She is dealing the topic, ethical issues and dilemmas in healthcare. She completed her post-graduation in psychology from Bharatiyar University, Coimbatore in 2006, MPhil and PhD from Sri Shankaracharya University of Sanskrit. Then she conducted many workshops, training programs, and faculty development programs. She published papers in national and international journals. She presented papers in state, national, and international conferences. Currently, she is working as the assistant professor in Jain University, Kochi. So, I welcome you, ma'am, to the session.
Thank you so much for the warm welcome. The topic that now you have all heard Dr. Gina explaining to you about the principles and the various bills regarding ethical issues. Okay, first of all, let me just share my slide. Okay, so is it visible?
Yes, ma'am, it is visible. Can you please share it in share screen? Yes, now it's okay.
Okay. Okay, so since you have now heard about all of the ethical issues, the bills regarding it, the decision-making procedures, what is bioethics and all, I'll be going straight away into the dilemma aspect, that is ethical issues and dilemmas associated when it comes to healthcare facilities. Now, before going into what are dilemmas, different dilemmas, I'll have to explain to you what dilemma itself is. Okay, so ethical dilemma is a situation where the practitioner, be it a nurse or a physician, will have to make choices between competing values. Okay, there might be two aspects where the physician or the nurse practitioner will have to take, and it can be both desirable or undesirable, and whichever the choices may be, okay, it will have its own consequences. That is a problem with that. Okay, so here, if the nurse has to choose, or if you, being the nurse, has to choose between two options, which is equally desirable or undesirable, you will be forced to compromise on one aspect when you're choosing one option. Okay, and or it will be like you will have to act against your own professional ethics or values. Okay, so when it comes to healthcare, there are situations where you will have to work for the organization. You will have to work according to your professional ethics, what you've learned. So many factors actually influence the decision that you're making. Okay, and of course, the first priority, as you all have heard or as you've all learned or been trained in, will be the patient's best interest. Okay, so many multiple factors will be there to influence the decisions that you're taking, and of course you will face a dilemma when you're taking that decision. So there are lots of definitions when it comes to ethical dilemma. I'm taking one. I'll be explaining one definition, which is by Hong and Sevenson in 2014, who explained ethical dilemma arise from conflicts among values, norms, and interests, and can be understood as tension of knowing the right thing to do, but experiencing when you're doing the right thing, you in the same time will experience institutional or other constraints, making it difficult to pursue the desired course of action. Okay, so nurses, unlike other professionals in the healthcare facility, they have more access, more time to interact with the patient and their family members. Okay, so nurses not only have to take care of the immediate needs of the patients and their family members, but they'll also have to face multiple demands from the organization, from their superiors. Okay, they'll have to keep law in their mind. They'll have to keep all those legalities in their mind. So when they are doing their work every day. Okay, so the nurse's decision making is actually very difficult. Okay, and because they'll have to adhere to bioethical principles, they'll have to have respect for autonomy of the patient. Okay, beneficence, non-maleficence, and justice. Okay, so the first ethical dilemma that I'm going to explain to you is regarding conflict of interest. Okay, now what is conflict of interest? Okay, conflict of interest is when a nurse's personal or business, commercial, political, academic, or financial interest, or the interest of the nurse's family members or friends, anything, okay, starts to interfere with the patient's with the nurse's professional responsibility or the client's best interest. Now, you might be a person who wants to work among people who want to give the best what is required for the patient, but there might be certain other aspects like there might be external influences or some experiences that you had just lately, which might try to start to influence into the values that you actually have. Okay, so this conflict of interest are in three ways, can be seen in three ways. That is, the first one is actual, potential, or the perceived in conflict of interest. Okay, the actual conflict of interest is the one that has already occurred or is currently happening. Okay, the potential conflict of interest is the one that could possibly develop in future, while the perceived conflict of interest occurs when others perceive that a conflict of interest may influence the nurse's judgment. Okay, now let me just show you a picture. I'm going to show you two pictures, in fact. The first picture is of this doctor, Dr. Vandana, who was attacked brutally by Sandeep, who was paranoid at that time. Okay, so we all know this incident, and this actually shook the medical, that is the healthcare system of Kerala, and in fact India, because we know that there are lots of instances that are happening where there are lots of attacks happening against medical professionals in the hospital, especially during the nights. Okay, and these issues have been coming up and going down lately. Okay, and there are decisions made based on this particular incident. Okay, now the conflict of interest. Why did I put this picture here? Is because one thing is that we know that there is a patient who came to the hospital for some reason or other. He wanted help. Okay, and the doctors were there, the nurses were there, the attendants were there. So many of them were there. Security people were there. Okay, police officers themselves were there, and this has happened. The murder has occurred. The person stabbed Dr. Vandana multiple times. Okay, so when it comes to conflict of interest, what happens is that the same circumstances, okay, the doctor has been murdered, and situation has turned out in a haphazard manner, but the patient is still there untreated. Understood? Okay, the patient still needs treatment. Will Dr. Vandana's colleagues who are unharmed, okay, treat the patient with utmost loyalty? That is one question. Understood? So that is where conflict of interest happens. What is the conflict of interest over there? The conflict of interest is that the nurses, the remaining nurses who are healthy and unaffected, in the sense not psychologically, otherwise physically, they have the duty to treat the patient who is there, who is Sandeep. Okay. The other doctors have the duty to treat Sandeep, who is there bruised and bleeding out there. Okay, so will they be able to treat that person properly with a clear conscience or happily? Okay, or will they be able to help that person without thinking about their colleague? Understood? The nurses will be thinking, oh, I just had my doctor who was just sitting over here. We just had a cup of coffee during the night. We were talking and laughing, and I can't treat this person. I'll not be able to treat this person. Understood? There's a conflict of interest over there, which is purely personal. Okay. Now, then that is, so what is the best alternative over here? The alternative over here is to transfer Sandeep to another hospital where he will be getting appropriate treatment. Understood? So I hope you understood what is conflict of interest in this aspect. Actually, one simple term, actually the term might seem to be simple, but actually there are lots of examples, lots of instances which can cause conflicts of interest. Okay. The second example that I've the image that I've shown over here is you can see a medical representative in front of a doctor. Okay. Now, you see that the medical representatives you might have seen when you were given postings in different departments. You might have seen medical representatives there with a bag and a brochure, which clearly explains the benefits of the medicines that they are representing. Okay, the drugs that they are representing. Now, the financial conflict of interest, that is the first point that comes here. The first point was regarding Dr. Vandana, and the second point is here is financial conflict of interest, where whether there is a balance between the financial interests, such as the doctor receiving huge benefits and gifts and incentives for the pharmacy from the pharmaceutical companies regarding the drugs, or it can be regarding medical devices from the manufacturers or any healthcare stakeholders. Okay, and whether their duty that they are going to do is unbiased, or is it influenced by the incentives and gifts that they received from the representatives. Okay, so when for example, if the physician has received a substantial amount of payment from the pharmaceutical company to promote a particular kind of medication, will the doctor or the physician be able to decide whether he or she should prescribe this medicine or not, or whether this will be actually beneficial to his or her patient? Understood? So this is without being influenced by the huge amount of incentive this doctor or the nurse is going to get, if he or she is able to influence the patient's decision about taking this drug, or whether even if he is prescribing this drug. Okay, so the third point is regarding the research and publication bias. Okay, now here the issue is in ensuring integrity of research and scientific publication. Okay, now the example over here can be like whether the researcher, who is a medical practitioner, okay, be it a nurse or be it a physician. Okay, the person who is doing a clinical trial, I hope you all know what is a clinical trial. Okay, you want to know the efficacy of a new drug before getting it into the market. You have to do people, the concerned person should do a clinical trial to understand whether this drug is actually beneficial to cure that particular disease. Understood? So when a clinical trial is being done, there'll be, of course, two groups being assigned. Like the participants in this group will be those persons who are affected with that particular disease. Okay, and without them knowing, you will be putting them into two conditions, where one will be actually administered the drug while the other will be receiving placebo. Placebo is something which is like which has no effect on that, which is not a drug at all. Okay, so now regarding research and publication bias, just imagine if the researcher who is doing the clinical trial, okay, has a share in the pharmaceutical company. Okay, so this is one aspect where if the nurse or the clinical practitioner is a shareholder of the pharmaceutical company, of course he might be having, it's not necessary that this should happen, but there will be a bias where they want to showcase that their drug is really good, okay, or beneficial for the particular disease. Now, whether the dilemma here, the ethical dilemma here involves in disclosing and managing financial interest to maintain the credibility of the research and impartiality as well. Okay, can you hear me? Can you all hear me?
Yes, ma'am.
Yes. Okay. So the next point is where organizational conflict of interest arises. Okay, so just imagine, okay, another example. My talk is all about examples, okay, so that you will get to understand the concepts really well. Organizational conflict of interest is like when a hospital, this is a very familiar example actually, okay, where a hospital has a financial incentive to increase the number of surgeries performed in a particular department. Say OBGYN, the organization explains to the gynecologist that if the number of cesareans, according to the number of cesareans, you will be receiving incentives. Understood? So the doctor there should now decide upon, there's a dilemma, whether actually the patient requires a cesarean or is a normal delivery sufficient. Understood? So here, there's an organization conflict of interest where the organization itself imposes upon the physician or the doctor to take upon a decision to increase the amount of surgery so that incentives will flow in. That means incentives will be received by the doctor as well as the organization is benefiting financially. Understood? There is a dilemma that happens in the doctor's mind where the doctor has to decide upon whether what is best for the patient or what is best for the organization. Understood? So there's a conflict of interest with that. And the next point is regarding recruitment of patient for research. We were talking about research, right? Where I told you people are put into two different groups where one is receiving placebo and the other is receiving the actual drug for the particular disease to be cured. Okay. So when it comes to recruitment of patient, again, there can be a dilemma. Okay. That is the physician who is involved in recruiting the patient for the clinical trial of a new drug. Now, just remember, it's a new drug. The physician doesn't know actually what might be the actual pros and cons of the drug. Okay, that is why the clinical trial is first of all being done. Okay, it's a new drug. Now, the ethical dilemma can rise when the physician must ensure that the recruitment itself is transparent. Okay, you are not, that is transparency here in the sense is that any patient who comes into the trial has an equal chance to be placed into both of these conditions. That is the clinical trial or the experimental trial, which is the clinical trial, or the controlled condition. Understood? So it should be the physician should be really transparent regarding it. There should be he or she should be really unbiased regarding it, and she or he should not be influenced by any personal or financial interest, which is really important. Okay. Then comes the patient referral and kickbacks. Now, we know that so many of the nurses and healthcare practitioners have their own tie-ups with other diagnostic centers. Okay, like labs and scanning centers. Okay. So when a doctor refers, doctor or nurse practitioner, okay, refers a person in writing or verbally to a particular diagnostic center, okay, what happens is that is actually when there is a tie-up with a diagnostic center, you know, the doctor or the nurse practitioner, whoever is receiving incentive per patient being sent or being referred to that particular diagnostic center. Got it? So is it actually necessary? The dilemma here is it actually necessary for the person or the patient to be sent to that particular diagnostic center? Does the patient at all require that kind of tests to be run on them? Understood? Or the other side is if they send it, they'll receive a humongous amount of incentive. Okay, so here that is the dilemma there. Now, then comes transparent decision making. Okay, an example is regarding where your medical institution, your hospital is about to procure certain medical equipment, be an MRI machine, be it a PET scanner, okay, be it even a syringe, you are procuring number of syringes from a particular manufacturer. Okay. Now, what if the medical board, the board members, okay, of that particular hospital has a shareholding, has a share in that particular manufacturer company. Okay, so here there is a bias that there's a potential bias, understood, that can happen where you being you in the sense, if you are the person who is a shareholder, you disclosing those information that I am a shareholder of that company, which mostly people don't do, okay, and ensuring that transparent decision making happens. Usually in hospitals, what they do is they don't just directly go and procure things, okay, they do it in a proper transparent manner where they take in quotations from different manufacturers and all to make it transparent, and which is actually something that helps in decision making, where they get good quality at a lower cost. Okay, then the next important point is in conflict of interest is patient trust. Okay, where they safeguard patients' trust in healthcare institution. Okay, towards the institution, towards the healthcare provider. Okay, for example, if a patient comes to know that that the surgeon or the medical practitioner has a tie-up with a manufacturing company and is prone to use that particular device on his or her patient. For example, if the patient is in need of a pacemaker, okay, is in need of a pacemaker, which is the medical decision that is made by the doctor, okay, and the patient knows that this doctor has a share in that manufacturing company. Okay, now there's a trust issue there. Okay, so how can this? There's a dilemma here that is happening, right? Conflict of interest that is happening, where the doctors actually is looking into the best interest of the patient. Okay, that is, the patient should receive pacemaker in order to lead proper quality, have a proper or a good quality of life. Now, the ethical dilemma involves where the patient should be dealt with regarding his concerns, okay, while maintaining the trust with the doctor. Okay, so transparent communication and shared decision making is one important thing that should happen with that. Okay, to resolve that dilemma. Okay, so to address these kind of ethical issues and dilemma, healthcare professionals and institutions should establish clear conflict of interest policies and disclose potential conflicts to patients and colleagues and prioritize patients' well-being. Okay, and trust. So this is one aspect. Next is paternalism. Now, paternalism is you just heard about autonomy, right? Patients have their freedom to take up any kind of treatment. I mean, if the doctor is prescribing a medicine or is suggesting or advising that this patient should go through a surgery or should take so and so medications, there is an aspect where the patient can refuse. Okay, that is autonomy. Okay, the patient says, I don't need any, if I feel that if I'm the patient and I am terminally ill, okay, or I'm having cancer, and I say that, no, I don't want chemotherapy. There are lots of patients who do that, okay? So it is ultimately I or me who's thinking about what I should do with my body, okay? Whether I should receive the treatment or not, whether I should receive a surgery or not, whether I should receive certain therapies and intervention or not. Understood? That is autonomy, where and the doctor should actually respect autonomy. That is the wishes of the patient. Okay. Now, paternalism is the exact opposite of it, where the authority or the person involved in the decision making takes that decision on behalf of others. Okay. Where the patient himself has no input or there's no consent taken. Now, how is that possible? Okay. Now, usually paternalism is seen as a well-intentional approach where it's my main priority is to care and help others. Or to be specific, the patient himself. Okay. In particular situation where the patient himself is too vulnerable or incapable of talking out their wishes. Okay. However, ethical concerns can happen where it may infringe upon the person's autonomy. and the right to make one's own choice. Okay, even if these choices are deemed unwise by others. Okay. Now, for example, let me just say an example to begin with. A lady has gone into a C-section, an emergency C-section. Let me just say it's an emergency C-section. And the person is rushed into the hospital by some unknown person. Okay, you don't have a bystander there. The lady was walking through the road, going to work or was coming back to work. There was nobody, like we say, the family members or friends around, and she started to bleed or something, and she was taken in by the auto driver or somebody who was walking by or passing by. And then this lady is brought into the emergency, the casualty, and she is suddenly taken into the labor room or the OT, where an emergency C-section is to be done. Okay, so 2 lives are now in the hands of the doctors, right? The baby and the mother. Okay, so here it is not wise to ask the auto driver to give consent, right? Usually the husband or the parents are the people who give consent, right? Will you ask the auto driver to put a sign? No, actually, those are helpers. There were lots of allegations regarding people stopped helping people on the road because they had to undergo so much of problem associated with helping a person who is injured on the road by accident or any other way. Okay, so we all know what are the legal procedures, what were the orders given by the court and all. That is, the hospital is, it's not necessary that the hospital should make the person who has helped the person to come to the hospital to stay over there and take up all the responsibility. Okay, so here what is happening is that now to do this emergency C-section, no consent is taken. Understood? They'll try to contact if they have received information regarding the lady's whereabouts. Excuse me, was that a doubt? Was that a doubt?
No, ma'am. No, ma'am. You can proceed.
Okay. Just a moment, okay? Okay, what I was talking to you was about the emergency C-section that was happening. You can see my screen, right?
Yes, ma'am.
Yeah. Okay, so just imagine that there's another instance where even though some bystanders or some family members have come, there are instances where the lady is, the baby has been taken out after C-section and the lady is profusely bleeding, and there is the lady's heart rate is getting weaker, and there is an emergency hysterectomy to be done. Okay, we know that the doctors, as a result of this, will send out a person to sign regarding this hysterectomy, emergency hysterectomy to be done, irrespective of whether the sign has been done, the consent has been taken or not. Here, the patient's life, of course, is the priority of the doctor, where the doctor starts to do the procedure immediately. Okay, so here is a decision, as we know, is a well-intentional one. Okay, where they are looking at saving the person's life rather than where there is a possibility, or not, it's not even a possibility, it is something that is going to take away the lady's chances of conceiving further. Understood? So that is one thing. Okay, so when we're talking about paternalism, again, autonomy versus beneficence. Okay, we have heard about autonomy and what is beneficence. Okay, so that is, autonomy is where the patient's wish is being respected. Okay, here when it comes to paternalism, here autonomy is not there, right? Beneficence is where you are, is it for the best, what is best for the patient there. Okay, so these are the two aspects which are in dilemma now, and the doctor goes for the beneficence rather than the autonomy, rather than asking the patient himself or asking the bystanders. They go for what is best for the patient. Understood? So next is informed consent, where a surgeon recommends. This is another example where the surgeon recommends a risky surgical procedure to a patient without fully explaining the potential complications or offering alternative treatment option. Okay, you understand? There is a point of deception over here. Okay, which this is another portion which I'll be looking into or explaining about. Okay, so informed consent, the doctors or the nurse practitioners receives informed consent, but actually, are they well informed? Got it? Are they well informed? Is one thing. Okay, so the patient consents without completely understanding what is happening or what are the risks involved in the procedure that is going to be done to his or her body. Okay, so the ethical dilemma is about the adequacy of the informed consent. Okay, next is the cultural sensitivity and values. Okay, so we all know, we look in India, which is a secular country, we know we have so many religion, we have so many things to look upon, right? We have religious factors, social factors, societal factors, family routines and rituals all start to influence our decision-making processes. Okay, so when it comes to cultural sensitivity, actually, the dilemma over here is regarding whether the practitioners should agree upon the cultural aspects and values that the family members or the patient himself or herself is holding, or whether they should go for a scientific approach which is more beneficial for the patient. Understood? So let me just say about and explain an example where a family from a very remote area comes to the doctor, is brought to the doctor, but the patient does not wish, like say she is in labor pain. Okay, she is having immense pain and she is not reached term. Okay, while when she is brought to the doctor, because by so many other people, like she's forced to come to the hospital and she doesn't want to give birth in a hospital setting, because she says that my mother, my sister, my cousin sisters, my sister-in-law, everybody gave birth at their own homes. So I prefer to give birth in my home. Now the dilemma is regarding whether the practitioner should force the person to stay at the hospital to get, to have a birth which is really safe, rather than sending her back to home according to her wish. Okay, I hope you understood. There are other instances where, people don't want blood transfusions. They particularly insist that they don't want blood transfusions to happen just because of their religious beliefs. Okay, there are instances where people who say that I don't need a doctor because God will heal me. Understood? So those are values and cultural aspects which to an extent doctors should respect, but to what extent? That is the main question over there. If the doctor and the nurse practitioner understands that, okay, this person is critically ill and requires medical attention, otherwise the person will lose his or her life. Now, where, on what extent should the practitioners work is one dilemma to be addressed. Okay. Now, psychological impact. So the physician makes a medical decision without discussing it with the patient. Okay. Now, this is another example that I told you earlier itself. Now, here, once the patient comes to know that, okay, this decision has been made by the physician and it was not at all my decision. Just say the same thing regarding blood transfusion, where the surgery was happening and the doctors had to do paternalism. We are talking about the doctor had to do a blood transfusion in order to save the patient. Now, the patient after surgery will understand that my wish was not served. Okay, doctors did not take my wishes or into consideration. Okay, they feel disregarded, disrespected. Now the dilemma is as a result of the potential harm to the patient-provider relationship. Okay. Next is resource allocation and justice. Okay, so here, say an example of organ donation or transplantation. Okay, you have two patients in front of you who needs transplant. Okay, and what is that criteria that will make you to decide upon who will receive that particular organ? Who is more eligible? Actually, both are eligible, and who is more eligible? You will be taking that decision based on maybe the quality of the life the person is following, whether they are taking. You'll be taking that decision based on so many things. But actually, whether the person is younger or older, all of those aspects will be taken into consideration. But actually, is it okay to deny an organ to the other person also is also another dilemma. Okay. The next one is end of life decision making, where the healthcare team decides to continue aggressive life sustaining treatment to a terminally ill patient. Okay. Even though there are aspects, instances where the patient might himself have said that I don't want to be a burden to my family members financially. Understood? So this is a clear dilemma where whether the practitioner should respect the patient's wishes or to sustain the treatment, medically aggressive treatment, which may or may not lead to success. Okay. Now, there are certain questions that arises as a result of paternalism. Look, to what extent is it morally necessary to secure a patient's consent for medical treatment? Okay. Then, is it morally acceptable to deceive? We were talking about deception, right? Is it morally acceptable to deceive a patient if doing so is a mean of protecting or improving the patient health? Is it morally acceptable? So, or what information can medical professional legitimately share with others in caring for their patient? Okay, and what are the moral limits for patient confidentiality? Then, who has the moral right to to make treatment decisions on behalf of children? Is it the parent? Is it the medical professional or the state? Now, we know that children, they are minors. They don't have that kind of decision-making skills. So what usually do is that the parents are usually the people who take medical decisions. Okay, there are instances where parents succumb or oblige to the decisions taken by the medical profession. What about the state? How can the state or the country have something, or paternalism, how can it be enforced by the state? Okay, I'm going to give you an example. This is one major thing that we might think about. Okay, now, whether it is autonomy or paternalism. Look, in countries like US and other Western countries, it is mandatory that children should be immunized against a wide range of diseases. Now, if being a parent, I am against immunization, but I want to migrate. We as a family want to migrate. I cannot go into that country without immunization or vaccinating my children. Understood? So this is something which the state requires. Okay, that is the state paternalism. Got it? I hope you all got it. Deception. I was talking about deception earlier. Now, deception as a dilemma as a whole, actually it encompasses through different areas when it comes to working in a healthcare facility. Now, what is deception? Deception is an act of deliberately withholding information. You don't say all of the information to the patients. That is where deception happens. Okay. And false, or it might be like when you are withholding information, it can be regarding providing false information or misleading patients or other stakeholders involved in healthcare decisions. Okay, like for example, when it comes to withholding information, you don't, when you're before going into a surgery, the practitioners explain about the procedures that are involved in a particular surgery, but the risks associated with it is not exposed. Okay, withholding of information is happening with that. Okay, or a doctor says that soon after laparoscopic, the next lap is going to be done. Okay, and soon after that, then very next day you can start going for work and do everything as you usually do. Okay, which is actually providing to an extent false information, because it's according to where and what kind of laparoscopic surgery was done. Okay, there are daycare laparoscopic interventions that are done. There are other ones. Okay, so I'm just saying an example. Okay, or there are instances where patients can be misled. Okay, so deception is considered as an ethical issue when it comes to when it undermines the principle of honesty, trust, and informed decision making. Okay, which is very important when it comes to maintaining integrity for patient-provider relationship. Okay, and to ensure appropriate care is being given to the patient. Now, in deception again, there are a few examples that I would like to, some key aspects of deception which needs to be kept in mind. The first one is again informed consent. You'll see so much of overlapping that is happening, but in each point you will see that so many overlapping is happening with the other point, which is naturally happening. Okay, now informed consent is where the surgeon or the nurse practitioner, whoever takes up makes the patient and or the bystanders to sign on the paper where it is clearly instructions are given regarding the risks associated with it. Okay, but the surgeon, for instance, when he or she deliberately withholds information about potential complications that can result as a result of the intervention of the surgery that is about to happen. Okay, so here you should understand that there's a form of deception where some important aspects of the surgery is not being informed to the patient. Okay, next is trust and patient-provider relationship, which I've already explained to you. Then placebo use is also another aspect. Now, earlier when I talked about placebo use, I was talking about a clinical trial, but placebos are otherwise also used. You might have seen people who goes into like with aches and pains. Okay, they go in and doctors prescribe vitamin tablets. Okay, actually vitamins have its own effect on the body, of course, that is undeniable. But what has vitamin tablets to do with pain if it has no relationship? Understood? So here, when the patient starts taking that vitamin tablet, which is not the original cause of the pain, okay, that deficiency is not there actually. Okay, so what is happening is that when the person starts taking the medication, if the person is not moving, the person feels that, okay, I am taking a medication which my doctor has, there's a trust over that. Okay, so the dilemma is regarding whether the potential benefit of the placebo effect justify the deception. Okay, now look, like I've already told you, the pains and aches can be psychological aspect. Okay, now privacy, going to the next point, which is privacy and confidentiality. A nurse aware that a patient has a stigmatized medical condition, okay, say it's an STD, sexually transmitted disease, the person is having, okay, or is having some other disease that is prone to an aspect where, to circumstances where the person can be stigmatized. Okay, and the nurse trying to protect the privacy and the confidentiality of the patient says to other medical team members that the person is having a different disease. Understood? So is it actually ethically okay? Understood. Ethical dilemma involves balancing the duty to protect the privacy of with obligation to provide accurate information to healthcare members. Okay. Now, there is another aspect over there where is it necessary if the patient is not dealing with other medical, the other team members, okay, is it necessary to give that sort of information to another person who is, of course, the staff of the hospital, but not an immediate member who is treating the patient? Got it? So there should be a balance of that. Then research and scientific integrity is also an important where deception is taking place, I told you, in the control group. Next is end-of-life communication. End-of-life communication is where the healthcare provider tells a terminally ill person that they have a good chance of recovery, while it is not there. So the main dilemma over here is whether you want to give hope to the person that there is a full chance of recovery when it is not there, or you want to be honest about the prognosis. Honesty regarding the prognosis can make the person to fall into a deep level of depression, okay, or deterioration in their quality of life, so on. Okay, so the level of deception over here is also a dilemma. Then ethical guidelines and codes. Okay, so deception can conflict with ethical guidelines and codes of conduct that requires honesty, transparency, and respect for the patient's autonomy. Now, an example is that the healthcare provider falsifies. Look, one thing is that if there is a medical error that has happened, okay, which is unknowingly done, maybe because of some in IT problem or something, your computer screen didn't had some glitches and all, and you got wrong information about your patient. Okay, instead of there was clear instruction regarding no sodium to the patient, and you by mistake started administering sodium to the patient through drip or something. It is, of course, you know, it is fatal. It can be fatal. It may be fatal, but nothing happened to the patient in the sense like you suddenly understood that this error has happened and it has been rectified by the doctor and you. Okay, and now nothing has happened to the patient. Okay, the patient, of course, had certain discomfort and distress, which made you realize that there is some mistake in what you have when you have initiated the drip. Okay, now the patient is safe. Okay, and there is a medical error that is happening. Now, according to the ethical codes and guidelines, you have to report. This has to be reported to the higher authorities in the institution. And what happens is that whether you will cover it up or whether you will report it. Okay. So deception in healthcare should be approached cautiously and only considered in exceptional circumstances such as placebo use when it is in experimental condition where you are testing a new drug. Okay. And when deception is contemplated, healthcare professionals should carefully weigh the potential benefits against the ethical principles of honesty, autonomy, and respect for patient rights. Okay. So I'm going to the next part, which is the privacy and confidentiality. You know what is privacy and confidentiality by now, because I have been talking about it from the beginning itself. Okay. Like you are protecting the patient's personal information to ensure that it is all those details are remaining private. Okay, so violating these principles can have actually serious consequences on the patient trust, quality of care, legal and ethical consideration. Look, most of you students aspire to go. I'm saying most of you because a small percentage of students after graduating from their nursing course, they prefer to stay back in India or in Kerala and work over here, serve their people. But there are certain people who prefer to migrate for so many other reasons. Okay. Now, working in a medical setup is actually much more stringent when it comes to Western countries. Okay. suing, that is you going into legal conditions, like you being sued by the patient, is something so common over there in Western countries. That is why this action, that is where this course, that is bioethics and ethical considerations and dilemmas, are actually important. Okay. The way things are held out over there in the Western countries and over here in India is actually so different. Okay. So what you learn here might not be something that you do so there, but what is learned over there, what you learn over here, and when you go over there, you will understand that the things are more stringent over there, and there are so many chances of you being sued. Okay. So this is not to scare you off or anything, but this is something to make you more capable, to be cautious, to take decisions in a more rational manner. Okay. Now, coming back, privacy and confidentiality. When the data or when the details of certain patients go out is leaked, okay, what happens is that there can be serious legal complications that comes associated with it. Okay, and consequences regarding that. Now, the first point associated there, some key ethical dilemmas associated are: one is patient autonomy versus public health. Okay, going to patient autonomy versus public health. Now, a patient, we all know that privacy and confidentiality should be maintained. Okay, and now, if a patient who is having a highly contagious infectious disease, okay, you might have so many diseases that are coming to your mind, right? And now any one of those, and this person refuses to disclose this information that the practitioners have found out among his or her close relatives, family members, or friends. Got it? Now, should the practitioner, the nurse practitioner or the doctor educate the family member or the bystanders regarding this disease, or whether the practitioner should keep it confidential just because the patient wishes to? Okay. Now the question is regarding if the patient's wishes kept as a priority, then what is happening is that there's a possibility that the close family members can be also affected. Okay, the close family members can be affected, or they might also need medical attention, or there's a chance of this disease to spread to other people, which can be a social hazard, health hazard, which can cause social health hazards. Okay, so patient autonomy versus public health. The next is informed consent and sharing information. The teenage patient seeks treatment for sensitive medical issue. Okay, now just imagine a teenage girl has walked into the OBGYN department for an abortion. Okay, she is about to become 18, but she is not. Okay, now she requests particularly that her parents should not be informed regarding this. So now there's a dilemma that is happening, whether this information should be passed on to the parents or not. Actually, there's no dilemma regarding this, because since the child is the teenager is a minor, usually the concerned authority do inform parents regarding this. Okay, because there is a procedure associated with that. Okay, but in the Western countries, there is a dilemma that is happening with that. Okay, now next is confidentiality of mental health records. Okay, usually a patient who is look, you have heard about Alcohol Anonymous and all, you know, people who have alcohol problem, who had alcohol problem, who are attending AA groups, okay, in order to avoid relapse. Actually, this is something which they are themselves motivated to go forward in order to avoid further relapse, right? Now, when it comes to mental health, okay, to what extent is it that we have to reveal certain confidential information that the patient has explained? Okay, so confidentiality of mental health record is when, in our Indian context, let me say, or abroad as well. Okay, when the patient has come to the practitioner, okay, regarding depression, okay, or and says that, okay, I'm having depression, but at times I do have this mood swings, okay, and it's not necessary that the patient wishes that this is not to be informed to the close relatives. It won't be done because confidentiality is one important aspect. But next comes the dilemma causing information, where the patient says that I do at times feel suicidal. Got it. I do feel at times suicidal. I feel like taking my life. Understood. So this is one instance where the patient himself has said that he doesn't wish that all what was confidentially talked to the therapist or the practitioner, which of course there'll be a nurse and all of that has heard all of this information and doesn't want this information to be disclosed to the near relatives or bystanders. Understood. But how, to what level should this confidentiality be maintained? Because one just imagine this case where the patient has come to the department, has spoken to you, has taken certain therapies, is on medication, and goes back and commits suicide. Who is answerable? Understood. So these are all aspects that should be cautiously dealt with. Then comes data security and electronic health records. Data security is regarding where in a hospital there'll be like thousands of data regarding each and every aspects of a person's life, right? Starting from Aadhaar, the date of birth, everything is there. The patient's address is there. The transactions that the person has done. So much of information is there in the hospital regarding each and every patient that is there. What happens when a data breach happens? Okay, when data breach happens, you know that the patient's details are exposed now. It has gone viral. It has gone, not viral, it has gone public. Okay, or it has leaked out of the hospital, which can be used in a different way where the patient himself can be harmed because of the information. Now, the dilemma here is regarding whether the organization or the healthcare members should inform the patient regarding the breach that has happened, okay, or to protect the integrity of the hospital and or the name of the hospital, okay. So ethical dilemma involves the organization's response, disclosure to the affected patients, and the efforts to prevent future breaches as well. Okay. Then third party access is something related to insurance people. Okay. Now, if you are a person who has insurance, who has taken insurance, okay, to claim that insurance people are the third party people who come directly to the hospital when you have put a claim, right? And they come to the hospital, they contact the hospital, they want information regarding what you are diagnosed with, what is your prognosis, what are the tests that you have done, everything. What are the medications that you are about to take, or what are the medications that what are the procedures that you're about to go through, or what you have taken. All of those informations are there. Okay. So insurance company, now how much of detail, or what is the limit, or where should the healthcare providers put the limit regarding sharing of personal details to the insurance company, who is the third party? Okay, that is a dilemma. And then patient-provider relationship, again, which has been again repeated earlier, where the patient confides in their therapist about the history of maybe childhood sexual abuse or something. Okay, and the therapist is called to the court because it's a medico-legal case. You might have heard about medico-legal case, right? Now, the level of the practitioner is in front of the court, okay, and you know what is the setup of a court, right? How much should the practitioner reveal regarding the patient is another dilemma. Okay, then ethical use of health data. Now, researchers, like I've told you, what if, look, when a researcher comes to the institution, a medical institution, for data collection regarding some aspect they want to study. Okay, what if there is a possibility that the researcher who has come in to collect data collects the data and use it for another purpose. Now, the dilemma is regarding whether the data is used adequately appropriately for the research purpose itself, while respecting the patient privacy and informed consent requirements. Okay, so this is one aspect where, you know, the practitioners or the health organization should keep in mind while they should develop and adhere strictly to the policies and protocols that addresses privacy and confidentiality of the confidentiality issues of the patient, while taking into consideration the principles of autonomy, beneficence, non-maleficence, and justice. Okay, open communications with patients about how the information will be used and how it is shared, all of those things, and all the data security measures, there should be a transparency in it. Okay, going to the next point, which is valid consent and refusal. Okay, now, like I've told you earlier, being a patient, okay, being a patient, the patient has every right to refuse and consent, give consent to any therapy or intervention or medication that is about to be administered on it. Okay, so valid consent refers to the patient voluntarily. Remember, it's voluntary agreement and informed agreement to undergo a medical treatment, procedure, and intervention. Okay, and it requires that the patient should have that capacity to take up that decision. Okay, to understand to process with what the information is being provided by the healthcare provider. The patient is well aware regarding the risk, that is the pros and cons of the surgical procedure or the procedure. Okay, what are the risks associated with it? What are the benefits that the person is going to get? And the person gets to choose freely, that is, gives a consent, or declines whatever is proposed by the healthcare providers. Okay, now here again, I was talking about informed consent. Okay, informed consent, where the person, the surgeon or the nurse practitioner explains about what is happening and what is going to happen, the pros and cons of the procedure that is going to happen, and then the patient understands and understands the information and asks questions if required, willingly agrees to undergo the surgery. Okay, which is what consents constitute of valid consent. Okay, the next is decision-making capacity, whether the patient clearly understood what is going to happen, or whether the patient is in a mental capacity to understand what is being explained to him. Okay, so this is again a dilemma when a person accepts or consents to a procedure or refuses a procedure, whether the person is having that appropriate decision-making capacity. Okay, that's a dilemma associated with that. Then coercion and pressure. Okay, that is, look, if you understand that, you being a practitioner, you understand that that the patient actually requires a particular surgery. Okay, and the person is refusing due to his or her religious beliefs. Understood? So is it okay to put pressure, because you know that if the surgery happens, the patient will have a good quality of life, the patient will recover, while the patient is not agreeing to just because of the religious belief. This is one dilemma. Then emergency situations, which I said earlier. Okay, the person who is brought in a critical condition to the emergency department requires a life-saving surgery. Okay, the patient is unconscious. You will not be able to gain consent from the patient or the bystander if the bystander is unwilling. Okay, so here there's a dilemma. Then pediatrics patient. Okay, pediatric patient, you know, if a person, if a child is there for a surgery, has come there with strong pain or aches or something and requires surgery, the child is really afraid of surgical procedures and doesn't consent. Okay. Now, here, of course, we'll take the consent of the parents, and of course, we'll try to explain it to the child, but the child's maturity and ability to participate in the decision-making process is one major dilemma that can occur. Okay. Now, cultural and religious belief, which I've explained already. Okay. Then there is another thing, which if you're all, if some of you all are thinking of planning to migrate. Okay. The time is almost up, right? Okay, anyway, migrate. There is this thing called advanced directives, which is not there here, okay? Where a person who goes into surgery in the US and all, okay? In the Western countries, what happens is that there is this thing called advanced directives where people give, patients themselves give advanced directives like, okay, I would like to, after surgery, if at all any complication arises, I would not like to be resuscitated. Do not resuscitate. Okay, which I'll be going into. Okay, if at all I am in a vegetative state, if in whichever condition I am after the surgical procedure, I would like to be on life-sustaining mechanisms. Understood? And so and so. There are advanced directives which we don't have here actually. Okay, so next, allocation of scarce nursing resources. Okay, so here decisions, making difficult decisions about distributing limited nursing personnel, time, resources to provide care. Look, when COVID-19 happened during the 2020 beginnings, there was this peak of death happening due to COVID-19, right? And we all know those cases, and we have seen so much of videos going viral, which is so sensitive, which is so heartbreaking, that the number of ventilators are limited, and some people's ventilators are removed on purpose in order to save another person who has more potential to live. Got it? Where these kind of instances did happen during the COVID-19 epidemic. Okay. So here decision making is really difficult, and it has so many other things to be taken into consideration while taking those decisions. Okay, so when we're talking about allocation of scarce resources, we know that it was during the pandemic we had scarcity of ventilators, life support systems in hospitals, where so many people were there with respiratory and cardiopulmonary failures, and ventilators numbers were too low, and so many people had to go through so much of problems. Some people had to die because of scarcity. Okay, next is patient prioritization, where in busy emergency department, nurses must decide whether to attend a stable patient with minor injury or a critically ill patient in need of immediate attention. Okay, so to whom should the attention be divided? We cannot, being one person, you cannot divide your attention to four person, right? So that is one dilemma. Then allocation of nursing time. Okay, like a nurse who's working on a busy medical surgical unit has several patients with complicated medical conditions. Okay, one patient requires frequent monitoring and medication administration due to critical condition, while another patient needs emotional support. Understood? So there's a dilemma that is happening where the nurse should be at that time. Actually, the other person requires more medical attention, while the other person requires emotional support. Okay. Okay. Then next is resource allocation during disasters. When we had this flood was happening, scarcity of resources was there, right? We couldn't help with people who were who needed immediate medical help. Like we couldn't help them because they were in remote places, they were stranded in certain places. It was not inaccessibility actually. towards the hospital, all of those were a problem. Okay, so an aftermath of the flood is something where actually the flooding of water and the flooding of patients in the emergency care units, right? All of those actually nurses had to face a tremendous, they had a tremendous time, right? Tremendous time. It was too difficult for them to help the patients, to deal with their bystanders, to deal with limited supplies. All of those were a problem. Shortage of medical personnel, shortage of medical equipments, shortage of the medicines. All of those were a problem. Okay, so this is a dilemma again. To whom these should be administered? Whatever available, to whom should it be administered? Then fairness and equity is regarding a nurse manager should determine to assign nurses to patient in hospital wards. That is, there should be workload consideration, patient equity, nurse expertise to ensure nurses are assigned fairly and that patients receive appropriate care. Okay, so that is one thing. The next kind of dilemma is regarding the conflicts concerning new technologies. Can I know how much time I have to wind up with the session? Ma'am? How much time do I have to talk?
Ma'am, 15 to 20 minutes, ma'am.
Okay, thank you. Thank you so much. Okay, so coming back, conflicts concerning new technology. Now we know that healthcare facilities have so much of new technologies coming in, and nurses are supposed to, earlier there were like this files and papers and sheets and forms and all, but now it's more into the use of laptops and computers, right? And all the information then and there should be fed into the computers, into the database, so that the information stays there and the information can be seen by the doctor anywhere in the hospital, is accessible by the pharmaceutical people. I mean, the pharmacy people can data from the information from the labs, information from the scanning department, information from the other doctors who the patient has consulted. All of this information can be accessed by that particular doctor or nurse who is treating the patient. Now, so we know that there are again conflicts regarding new technologies. That is, new technology is actually used to improve quality, safety, and efficiency of healthcare, right? We know that there is this medical record which is electronic, the clinical data processing which is IT, telemedicine. Actually, during the COVID, there was the telemedicine that was happening. Okay, then remote monitoring happens. Personal health records are there. Health information exchanges happen. Electronic prescribing is happening. And computerized physician order entry is happening. Home monitoring of patients. All of these are happening using IT tools. Okay, and these are clearly to enhance the treatment strategies, okay, and to maintain quality of all those that are done in the healthcare system. Now, there are conflicts that can arise due to ethical, legal, financial, and practical consideration over here as well. Okay, like as the technology advances, it can lead to advancement in patient care, as well as complex challenges can also arise as a result of this. Okay, so some common conflicts related to new technologies are: first one is patient privacy and data security. Okay. Like here the conflict can be like when data is available in the hospital system, which is acceptable, accessible by different departments. Okay, is patient privacy and confidentiality kept is one major question. Okay, the next one is regarding access and equity. That is telemedicine. Now we were talking about I told you about one tool which is telemedicine. Telemedicine actually allows patients to access doctors, get access to healthcare facilities even if they are in the remote areas. Okay, but can we say that this is happening to all the people who are in remote area? Because they should have that kind of facility. Are they having internet facility? Are they having proper mobile connectivity? Okay, is this facility available in, or it's regarding the accessibility and equity regarding people who are in the tribal area? Are they getting access to the hospital facility through telemedicine? Okay, then resource allocation is again where high cost of implementing and maintaining new medical technology can strain the healthcare budget. Okay, and create conflicts in resource allocation. That is when so many cuts will happen, so many demands will come on to the nurses and the practitioners. Okay, then comes clinical decision making, where health providers may face conflicts when relying on technology-driven clinical decision support system, where there should be a balance between technology, recommendation, and their clinical judgment. Okay, so like for example, there are so many algorithms now which will actually help the physician, which will assist the physician to come up with a decision regarding diagnosis and prognosis of a patient, okay, or regarding the medication and its dosages. Okay, but that algorithm always accurate? There is something called the clinician decision again. The clinician or the practitioner might have a different idea, which is something different from what the algorithm or the IT tool has, or the program itself has suggested. Okay, so the physician believes that the algorithm says, for example, that to administer a higher dose for the patient, okay, to the patient, while the clinician clearly understand that, okay, that dose is too high for the patient, which might be riskier. Okay, and the clinician thinks about it, takes a decision, okay, or is in dilemma whether the clinician should go forward with his or her own decision, or go by the algorithm which the organization has provided in the form of a program. Okay. Now, here also actually, yeah, okay. Then comes ethical use of artificial intelligence. Okay, ethical use of artificial intelligence is like you have in the hospital an AI-driven medical diagnostic system. Okay, and you find that this medical diagnostic system has its own biases in the sense in certain demographic group. Okay, so you found that misdiagnosis is happening. Okay, and unequal healthcare outcome is also happening as a result of this. So there's a dilemma whether you want to go for it or against it. Okay, then end of life technologies is like a patient who's having severe brain injury is on life support. Okay, now the family is facing a problem, a difficult decision whether to continue with this life support, this treatment, or to withdraw it. Okay, which I'll be again looking into in further. Okay, then comes patient autonomy and informed consent, which I've already explained to you. The next portion is whistleblowing. Now, what is whistleblowing? Whistleblowing is something that actually occurs in an organization where you, being the nurse practitioner, you feel that something is not right that is happening within the organization. Okay, that is, you feel that you want to report it. Understood? You want to expose that issue to the authority or the public. Now, usually that is called as whistleblowing. Okay, the act of a healthcare professional reporting something unethical or illegal or unsafe that is happening within the organization. Okay, so initially what usually the nurse practitioner or a doctor will do is report it internally to the higher authority. Okay, that is whistleblowing. Now, here there is a significant concern regarding you being ethically responsible for the patient, to protect the patient, or is it that you are going against the organization? Understood? Now, key aspect of whistleblowing is ethical responsibility, like I've told you, like where you are working in a you being a nurse who is working in a long-term healthcare facility and witnesses that there is abuse that is happening to the people, elderly residents who are staying there or who is undergoing treatment. Understood? Now, in spite or despite of you reporting it to the higher authorities, no action is being taken. Okay, now you are in a dilemma whether you have to go along what the organization has told you to, or that is to neglect it, to do your job without looking at it. Okay, or the other side is you go public, you talk it out to the medias. Okay, so that is there. Then the second dilemma is where you being a whistleblower, do you want to be a whistleblower, or you have this fear of retaliation? Do you want to do good to your patient, or do you want to lose your job? There are two things, right? You are going against your organization and higher authorities, and what happens as a result? You're actually doing something which is good for the patient, right? But you're losing your job. Next is patient safety and quality of care, where you will be seeing so many things that is happening over there, which increases the revenue of the organization. Okay, which is done in order to increase the revenue of the organization, but is not done in the best interest of the patient. Now, or it is putting the patient in risk. Okay, so this is an ethical question that arises, and it's your duty. You think about whether you want to protect your patient or to go against. Okay, legal and ethical obligations are the same thing, where you see a child abuse, okay, and you suspect the child is in danger, and then what happens is that you want to report it to the authorities, where the family members will say that, no, please don't say it to anybody, because my family reputation, we'll be stigmatized, we'll be discriminated from the society. So don't please, say it out. Okay. So this is one major dilemma that actually happens most of the time. Then, then comes internal reporting and external whistleblowing, whether you want to keep certain information within the organization and deal with it, or whether you want to go public. Okay. So the next issue is beginning of life issues, where you know that this is something that surrounds medical decisions, intervention, and practices that affects individual at the earliest stages of the life, like say from conception to birth. Okay, so here it's not so simple like when you say from conception to birth. It involves complex ethical, moral, legal, and cultural dimensions as well, out of which we have actually gone through which I've already explained certain examples regarding birth and complications regarding decision making. Okay, now some key beginning of life ethical issue is abortion. Okay, now abortion is one important aspect. Just think about a lady who discovers that she's pregnant but faces serious health complications. Okay, she is the person who has to decide upon whether she has to go for an abortion or not. Okay, now the question here, the dilemma arises among the practitioners is that whether we should look into the potential interest of the lady, whether the lady wants the baby so badly, okay, and she is ready to risk her life for it. Okay, now the dilemma is regarding whether you want to go for the interest of the lady, that is the autonomy, or the potential life of the fetus, okay, or you want to look into the health of the lady. Then in vitro fertilization or IVF, which we have already heard, and embryo disposition. This is to an extent done in India, the embryo disposition, that is what I'm talking about. Okay, so in vitro fertilization, as we all know, the couple is undergoing IVF. Okay, IVF, and creates multiple embryo. Now, this is one thing that needs to be taken seriously into consideration. Okay, look, a couple wants a single child. Now, the couple understands that they have a twins or a triplets or quadruplets. Understood? Just imagine a couple is having 6 children. Understood? 6 babies in the womb. Okay, different embryos. In Western countries, what happens is that they have an option whether they want to stick on to 1 child, 2 child, 3 child, depending upon the condition, of course. Okay, that is embryo disposition. Now, the dilemma is regarding whether you have to go forward with this, or help the lady to go, or encourage the couple to go forward with all of those pregnancies, or to what to do with the other embryos, that is to conduct selective abortion, or to these are all options that are there in Western countries, there where they're donating the embryos to couples who don't have children. Okay, then genetic testing and screening is other dilemma causing thing, where pregnant women opts for prenatal genetic testing to screen for chromosomal abnormality. Now we don't think this is a problem, because we would quality of life is really important for the child, right? Chromosomal testings are done to every woman, right? Mostly if there is a risk associated with whether the lady had has a history of abortion earlier, okay, or a genetic problem that is seen in her personal history. Now, ethical consideration may come into play when the woman and her healthcare providers must decide how to proceed with this information. Like, if genetic testing has taken place and they found that the child is having a small abnormality, whether they have to go or continue with the pregnancy or to abort is again a decision that has to be taken. Then NICU, neonatal intensive care and end of life decision. Now we all hear that so many children are babies are born prematurely, right? And premature baby, I hope you have all seen children as small as infants, as small as 6 months. Okay, they are born premature. That is towards the end of the second trimester. Due to some complication, emergency C-section had to be done, and the baby had to be taken out. Now, is it the dilemma is regarding the health of the child now, the baby now. Okay, is the baby in a good condition, and is the baby healthy enough to withstand the support that is given, or if at all, is the baby capable of having a good quality of life further? Okay. Next, surrogacy and reproductive technology is where a surrogate mother, you know who is a surrogate mother, right, gets pregnant in order to give the baby away to an adopting parent. Okay. Now, the dilemma arises when the surrogate thinks that after the full term and the mother delivers the baby, she decides upon keeping the baby to herself rather than giving it away. Okay, so there is a disagreement that if there is a disagreement that arises between the surrogate and the intended parents about custody and parental rights, then access to reproductive health care. Now, as I've told you earlier, tribal regions, remote areas, are they having proper access to the healthcare facilities due to, say, socioeconomic conditions or geographic remoteness? Okay, here this raises question regarding unequal access to essential care. Now, we are talking about the next topic is regarding end of life issue. We are coming towards the end of the session, actually, where end of life issue actually encompasses complex ethical, medical, and emotional considerations surrounding the care and decision making for individuals who are approaching towards the end of their life. It can be, end of life can be due to age, due to medical conditions, due to terminal conditions like cancer, like, you know, 4th stage cancer and stuff like that. Okay, so it often involves ethical dilemmas where the healthcare providers, patients, and families must make certain challenging decisions. Now, some key issues excuse me, are withholding or withdrawing life-sustaining treatment. Okay. That is, like I've explained earlier, if the patient is in a terminally ill condition, okay, and there's no hope, the patient is already on a ventilator and is being provided with artificial nutrition. Okay. Now we know the patient's condition is deteriorating and there's no hope for recovery. So the healthcare team and the patient's family faces an ethical dilemma whether they have to continue or withdraw the treatment. Whereas withdrawing or withholding the life-sustaining treatment will lead to the death of the person. Okay, so that is one dilemma. The next one is, like I've told you, this is not so much over here. It is towards the Western countries. Those who are going outside will know more about it. That is advanced directives and surrogate decision making. Okay. So the patient is having a living will over that. Okay. Will regarding their desire to forego life-sustaining treatment if they become terminally ill. So, if they're unable, that is the advanced directive is there, which showcases that if they are unable to, when they become in a stage where they are not capable of communicating, okay, everything is indicates there regarding the desire, what should be their life post the intervention. Okay, so that is the patient's family might disagree, but here, when it comes to Western countries, the patient's will is actually given more priority. Just a moment, okay? Okay, so that is about advanced directive and surrogate decision making. Then comes palliative and hospice care, where you know that a patient who is having end stage life, that is having illness, terminal illness or heart failure, and is no longer responding to any kind of treatment. So the healthcare now team faces a dilemma whether the patient should be kept in the hospital under care or should be left back home. Okay, so or should be sent to a hospice care. That is another dilemma. And next is cultural and religious belief, which I've already told you, where people, this is mostly regarding euthanasia. Okay, euthanasia in the sense we don't practice euthanasia over here, but there is this passive euthanasia that is happening where the life-sustaining treatment is withheld. Okay, but there are cultural beliefs where they say that, okay, let my father or my mother or my beloved pass away naturally rather than sustaining his life by artificial mechanisms, or even giving like even they are against mercy killing as well. Okay, beliefs, religious beliefs and cultural factors do create dilemmas at times. Okay, then comes managing pain and suffering. Gina ma'am earlier told about giving morphines, right? When the patient is highly in pain, administering high, they have administered a level of dose which is not actually helping the patient. Okay, now is it okay to administer higher dose of morphine, which might potentially cause harm to the patient or may be fatal to the patient, or is it that you see the patient suffering all alone? Okay, that is a dilemma. So how do you manage it? Then futility and limited resources. The patient who might have advanced dementia, okay, is repeatedly admitted to the intensive care unit for life-sustaining treatment. Okay, so we know that interventions will provide only little benefit. Actually, it's not giving so much of benefit to the patient. Now, the dilemma is regarding whether the patient with the severe dementia should be brought again to the hospital or should be left at home. I mean, to be kept at home in peace and pass away in peace. So this is again a dilemma. Now, going into selective deductions. Okay, selective deductions is like the practice of withholding and withdrawing medical treatment or life-sustaining intervention from certain patients, okay? And this is based on certain criteria and decisions made. Like, for example, do not resuscitate, which I told you earlier. This is mostly towards the Western countries where it is mentioned in the advanced directives, okay? But here in India, do not resuscitate order is actually done under certain circumstances where the patient is already resuscitated several times and is having more damage than being resuscitated, okay? And the chances of the person to go into a vegetative state is more. So then this is being signed by the bystanders because there's no hope for them. Okay, then withdrawal of life support, I've already talked to you about. Resource allocation is also another thing which has been discussed over here, where they might make selective, the team members might make selective deductions to withhold ventilator support from patients who do not meet the established criteria. Okay, so here this is done because there is a limited amount of resources. Okay, then next is voluntary stopping of eating and drinking. Some elderly people, due to the terminal illness, they have so much of pain. They are going through so much of pain. They think that nothing is helping them. They feel so hopeless, and they feel that there's no purpose in living, and they cannot do anything about it. So they'll just stop eating and drinking. Okay, now you know that there is a higher chance of these to cause dehydration in the person and malnourishment, and which will ultimately speeden up the death of the patient. Now, this is a dilemma where this is a choice which the patient himself has made about not to eat and not to drink. Okay, but again, is it okay to respect the patient's autonomy or try to save the patient? Okay, next is euthanasia. Euthanasia is, as you all know, deliberate act of ending a person's life, which otherwise we call as mercy killing. Okay, because the person is going through severe pain, incurable suffering, and terminal illness. Okay, it is illegal in India, but it is legal in Western countries. Okay, under certain circumstances, this euthanasia is done. Okay, the euthanasia dilemma in India is due to its legal framework over here in India, which doesn't permit because of the cultural influences. Okay, and there are dilemmas regarding right to die and sanctity of life. Okay, and patient autonomy is one aspect where the patient might feel, I can't take up this pain so much. I want to have a death. Okay, I want to die more. I want to die immediately. I don't want to be a burden to my family, and so and so. But is that, are we going for the wish of the patient, or are we going to look in the best interest of the patient? That is euthanasia to be given or not to be given? Okay, end of life decision. Actually, as I've told you earlier, there are lots of restrictions when it comes to euthanasia. There are lots of debates that have gone with this this term itself, euthanasia. But actually, this has not been legalized in India. Okay, end of life decision making is like where a family is divided over where the father is under treatment and the daughter says, no, I want my father to be on ventilator because I have a hope that he will survive. While the son says, like, all the financial resources are over, and the doctors repeatedly have said that this is no, his condition, with his condition and with his prognosis, there's no hope of recovery. Okay, so the family is divided and there is a decision to be made. There is a dilemma out there. Okay, now palliative care access is like where the patient in rural area of India has a life-limiting illness and faces ethical dilemma of enduring pain and suffering due to limited access to palliative care. Okay, now in India, debate surrounds euthanasia, and here there should be a balance regarding respecting the individual's autonomy, cultural and ethical values, and legal framework. Okay, while euthanasia remains illegal, discussions do continue. Okay, regarding how whether to enact legislation to allow specific form of euthanasia, that is passive euthanasia, that is you are withdrawing or withholding treatment life support, which is under strict safeguards. Okay. So this is all about, and DNR, as you all know, DNR is something which you don't do over here. Okay. DNR is a do not resuscitate, is not in the sense like the patient has not, do not have so much of say in India regarding DNR. Okay. Because all of those kind of aspects are there in the advanced directory, which is used, directives which are used mostly in the Western countries. Okay. So I hope you have all understood about the ethical dilemmas regarding all of these aspects that can come in. Ethical dilemmas with DNR order in India is actually not according to the wish of the patient, but it is under certain circumstances, like I've told you, signed by the bystanders. Okay, where decisions are to be taken, where comfort measures are to be taken into consideration. And let me say, non-compliance is also another thing where I've already told about, where the patient refuses to comply with the doctors. Okay, and non-compliance, that is the autonomy. That is autonomy. Okay, autonomy is one thing which the patient patient has regarding the rights what he or she should have, whatever treatment he or she should have on his body or her body. Okay, so non-compliance compliance is also another aspect where the medical practitioners will have a problem regarding whether they have to enforce whatever treatment strategies or regimen they have on towards their patient, or whether they should go along with the patient's wishes. Okay, so because of time constraints, I have actually taken so many. I had to rush off to this end of this portion. So thank you so much. Any doubts regarding this?
So thank you, ma'am, for your wonderful presentation. Now the session is open for discussion. Delegates, you can post your questions in the chat box or YouTube, or you can raise your hand click button so that we can admit you. Queries, please. So if you don't have any question, means we can move to the feedback session. So now we are entering into the feedback session. Delegates, you can find feedback link in the chat box. Please enter the details and submit it. Please note that the feedback link will active only for 15 minutes. Now I invite Mrs. Anju Thomas, Assistant Professor of Samaritan College of Nursing, to deliver vote of thanks.
Good afternoon, everyone. Now we have reached the end of this webinar. I, Anju Thomas, Assistant Professor, Samaritan College of Nursing, take this opportunity to put my gratitude into words. Firstly, I thank Almighty God for making this event a grand success. I extend my sincere thanks to Professor Dr. Sister Shalini SD, Principal, Samaritan College of Nursing, for taking effort to organize and inaugurate this webinar. She was the one who provided us a platform for conducting this webinar. Thank you, sister, for encouraging all of us. Next, I would like to thank Professor Dr. Next, I would like to thank Professor Dr. Sister Sajina ST, Vice Principal, Samaritan College of Nursing, for all her immense support and guidance to conduct this webinar in a successful way. Thank you, Sister. On behalf of Samaritan College of Nursing, I would like to extend my heartiest thanks to our resource person, Dr. Jeena Madhavan, Associate Professor, Jain deemed to be University. You are an exemplary person with lots of knowledge in medical ethics. We have received an overview of ethics and bioethics from you. Thank you, ma'am. Heartfelt thanks to Dr. Rachel Jodhi Alex, Assistant Professor, Jain deemed to be University, for taking out time from your busy schedule and providing such an useful insight and views regarding ethical issues and dilemmas in healthcare. Thank you, ma'am. I thank all the participants from various institutions for your active participation that made this event a fruitful one. Thank you all. I extend my sincere thanks to the organizing secretary and HOD of Medical Surgical Nursing Department, Mrs. Sajna Koshi, and entire crew for taking effort to make this webinar in a successful one. Thank you, dears. The support and cooperation extended to faculty from other departments, our technical assistant, Mr. Akhil Kumar, and other non-teaching staff of Samaritan College of Nursing is commendable. Thank you all. With this sense of appreciation, I thank all volunteers who work both on the screen and behind the screen to make this event happen. Standing as a pillar of strength, they work beyond the comfort zone to take on completion of this program and achieving excellence. Once again, I thank each one of you on behalf of the organizing team. Thank you all.
Thank you, Anjumis, for the words of gratitude. So this concludes the webinar. I hope that this webinar is informative and useful. So once again, thank you for spending us today. Hope you had a grateful time. Thank you. See you again.